Order, please. I'd like to call the Law Amendments Committee to order. Good morning, everyone. Welcome to the Legislative Assembly of Nova Scotia, one of the most beautiful buildings in our country. And we're glad you could join us today as the committee deliberates on 5 bills here this morning. I'd like to begin first off by asking my colleagues at the table to introduce themselves, and we'll start with Ms. LeBlanc.
Good morning. I'm Susan LeBlanc, the MLA for Dartmouth North.
Good morning. I'm Lisa Roberts, MLA for Halifax Needham.
Good morning. I'm Brian Comer, the MLA for Sydney River Mara Lewisburg.
Good morning. Elizabeth Smith-McCrossan from Cumberland North.
Good morning. Patricia Arab, Fairview Clayton Park.
Good morning, and thank you for being here so nice and early. And I'm Margaret Miller, MLA for Hants East.
Good morning, everyone. Brendan McGuire, Halifax Atlantic.
Good morning. Jeff McClellan, MLA, Glace Bay.
And the committee is joined here by Gordon Hebb on my right and Karen Kinley from Legislative Council to assist us in our proceedings today. Just a few housekeeping items to run through with folks. Please turn off your electronic leashes, otherwise known as a cell phone, to vibrate. And washrooms are down the stairs, turn left at the base of the stairs, and that's where the public washrooms are. And in case of an emergency, please exit the first set of doors halfway down the stairs on Granville Street, and we will gather at Parade Square. Now, this committee operates under the rules of the Nova Scotia House of Assembly, so the rules that are in the chamber also apply here. So there's no pictures permitted or video except from accredited media. And as well, we need to ask the gallery not to demonstrate in any way with respect to the proceedings, either in approval or disapproval of the conversations we're having here at the table. And I think that wraps up that. This is the opportunity to hear from the public on these various pieces of legislation. As I said, we have 5 bills, 4 of which do not have representation here this morning. So maybe we can deal with that first off. So I'll call Bill number 234, the House of Assembly Act. Could I have a motion, please? Mr. McClellan.
Thank you, Mr. Chair. I move that Bill 234, the House of Assembly Act, be brought back to the floor of the legislature without amendments.
Thank you. Discussion. All in favor, please signify by saying aye. Opposed? Motion is carried. Thank you. Bill 236, the Railways Act. For everyone's information, you should have 2 letters on this act that we've received. But with that, I'll ask for a motion, please. Mr. McClellan.
Thank you, Mr. Chair. I move that Bill 236, the Railways Act, be brought back to the floor of the legislature without amendments.
All in favor, please signify by saying aye. Aye. Opposed? Motion is carried. Thank you. Bill 238, the Insurance Act. Mr. McClellan.
Thank you, Mr. Chair. I move Bill 238, the Insurance Act, be brought back to the floor of the legislature without amendments.
Thank you. Discussion. All in favor, please signify by saying aye. Aye. Opposed? Motion is carried. Thank you. Bill 240, the Life Partners in Long Care Act. Ms. Smith-McCrossan.
Thank you, Mr. Chair. PC Caucus would like our colleagues to consider making a recommended change to this act. On page 1, clause 4, we're requesting that the following be added. Where the Provincial Health Authority operates or funds a facility for the purpose of providing long-term care to veterans, the life partner of a veteran who is a resident in the facility is allowed to become resident in the facility on the same basis as if that life partner were a veteran. And that's page 1, clause 4, renumber as 5. And we do like this bill. We don't think that people should be separated when they're at a point in their life when they require long-term care, and when they've been married to someone for 50 or 60 years, they shouldn't have to be separated from that person. And we'd like our veterans and their spouses to have that same consideration. Thank you, Mr. Chair.
Ms. Roberts.
Thank you. I know that the government has indicated intention to make this possible. However, I think given the slowness in responding to make this possible, and given that indeed this whole piece of legislation reflects what is already within the government's purview to do through policy, I'm certainly supportive of this.
Mr. McClellan.
Thank you, Mr. Speaker. Mr. Chair, I think that, Elizabeth, quite frankly, it seems reasonable just sitting here, but I don't have any of the back sort of understanding of the implications on this. I do appreciate the importance of the bill overall and that it's moving forward. I think if it's okay with the committee here, Mr. Chair, that we take this to the committee of the whole process. I think that just to talk to the minister and have the opportunity to speak about it between here and the committee would be probably most prudent for the government. So if that's okay, again, I think if we can take it back for that process in the Committee of the Whole House on Bills, I think that would be ideal from our perspective.
Thank you. Any further discussion? All in favor of the amendment? Opposed? Nay. Motion's defeated. Looking for a motion to refer? Ms. Miller?
I move that we refer Bill 240, the Life Partners in Long-Term Care Act, to the House of Assembly without amendment.
Further discussion? All in favor, please signify by saying aye. Aye. Opposed? Motion is carried. Okay, thank you all. Next is Bill 233, and we now have a list of 29 presenters to keep us busy this morning. We'd like to thank you all for coming here today. Each person will be given, thank you. Each person will be given 5 minutes for a presentation and 5 minutes for questions from the committee. You certainly may forego the questioning and go further. I'll do my best to give you a 1-minute warning at 4 minutes and also at 5, but again, it's your choice whether you wish to continue beyond the 5 minutes, and then we'll open it up to the floor for questions. As well, I'd like to remind our visitors that please wait to be acknowledged by myself as the chair. That allows your microphone to be turned on and Ledge TV to get you on the camera. So with that, I'd like to begin with our first witness, Mr. Daniel David, President of the Vaping Industries Trade Association.
Sorry, I just didn't want to make sure you hadn't forgotten.
Welcome, Mr. David. The floor is yours.
Good morning. I'd like to thank you for the opportunity to be here today. My name is Daniel David, and I have the honor of serving as the president of the Vaping Industry Trade Association, or VITA. We are the largest vaping industry trade association in Canada, and we represent individual vape shop chains, e-liquid producers, distributors, and multinational vape brands. Our mission is to represent and support the Canadian vaping industry in advocating for harm reduction, youth prevention, evidence-based regulations, and best-in-quality safety standards. I myself am a former smoker. I'm a vape shop owner, an advocate, and a proud father of 2. In 2014, I presented testimony to the Law Amendments Committee to advocate against proposed e-liquid flavor ban. I was proud to have been there. I was proud to watch this committee listen to the testimony of dozens of former smokers who converted to vaping. And not only listen, but to do something about it. Vaping is not the evil or deadly product that it's being made out to be. And I hope you can keep an open mind when listening to the testimony of myself and other passionate vapers like me. As many of you are aware, vaping has become a vitally important harm reduction technique for adult smokers seeking to quit traditional tobacco. We've seen hundreds of thousands of Canadians make this migration because we know that while vaping is not harm-free, it is significantly less harmful than traditional tobacco. And despite what some may have you believe, we have well over a decade of solid scientific and credible research on vaping as a tobacco harm reduction strategy. Just to briefly highlight the significance and importance of that, I'd just like to read you a quote from the Royal College of Physicians. Although it is not possible to precisely quantify the long-term health risks associated with e-cigarettes, the available data suggests that they are unlikely to exceed 5% of those associated with smoked tobacco products, and may well be substantially lower than this figure. Considering that Bill 233 will introduce significant new barriers for adults in accessing products that are truly mitigating harm, we are certain that some components of the Act related to vaping products will in reality work against the goal of improving public health and protecting youth. While the proposed legislation would introduce in Section 3 positive elements that will assist in limiting youth access, which we support, we believe that the restrictions on flavors and nicotine content would have the effect of increasing illicit and unsafe access to vaping products. In regards to flavors, research has shown that for many adults, flavors are a vital component in the transition from traditional cigarettes to vaping. This is important from a public health perspective because we believe that if legal, regulated access to products that adult consumers want is overly restricted, then many will turn to the illicit marketplace or return to smoking to tobacco. Our greatest fear is that over-regulation will drive the creation of a new black market, which can only put more youth at risk. This is why we believe that continued legal access to a diverse range of flavor and nicotine vaping products is vital for adults and also vital for protecting youth. The last thing that we want to see is a replication of the situation in the US where unregulated, illicitly produced THC vape products led to a major health crisis.
1 minute.
That being said, we absolutely agree that vaping products should not be accessed by youth. Our sector strongly desires to work with government during the regulatory development process to ensure youth are protected. Adult smokers who are struggling to quit traditional tobacco can still avail themselves legally to important harm reduction tools. Additionally, we are concerned with the proposed establishment of further nicotine content restrictions. The current nicotine levels on the market have been legally available to adult vapers for nearly 2 years. Any substantial reduction in nicotine levels will lead the adults who rely on them to look to the illicit market, significantly increase consumption, or return to smoking tobacco, which is the leading cause of preventable death and disease globally.
5 minutes.
In addition, it would make it more difficult for adult smokers to migrate away from traditional tobacco. While we recognize such limits would be prescribed by regulations, VITA believes that this committee should understand that setting these limits should be conducted in a science and evidence-based fashion that reflects the diversity of various delivery methods on the market. As such, we would very strongly encourage the members of this committee, in particular the members of Government Caucus, to ensure that the ministry works closely with the vaping industry, harm reduction experts, and other stakeholders to ensure that nicotine thresholds potentially established through regulations actually help us achieve the public health objectives. Moreover, we would further ask that the government, and indeed all parties, commit to regular regulatory reviews to ensure that both nicotine and flavor restrictions that are established are effective, reflect the evolving nature of consumption, and most importantly, support the migration away from traditional tobacco. In closing, I would like to again thank the committee for the opportunity to appear. I want to again stress that our industry, our association, is not opposed to regulation of our sector. In fact, we strongly support it. Regulation allows us as a society and community to shift people away from traditional tobacco consumption in the safest fashion possible. We absolutely support this objective and believe we can be a valuable resource to policymakers as we move forward. I'd be pleased to take any questions that you may have.
Thank you, Mr. David. Mr. McGuire.
Thank you for being here today, and I appreciate your passionate words. Over the last couple of years, well, since I've been doing this, I spend regular times in schools, junior highs and high schools, and I speak to students, and over the last couple of years, the number one issue, time and time again, that we hear from students, from their malls, not mine, unsolicited, is that vaping in schools is on the rise. So we've seen a decline in tobacco use and nicotine use. When I was younger, there was a lot more children in school, in high schools, smoking cigarettes. We've seen that decline, and now we're seeing the sudden rise. And from their malls, they're saying it's because of flavored vaping. So they're saying they do this thing where they all buy different flavors, they swap it, and then to further that, one of the conversations that when we go down this road, I'll say, well, what we hear from the industry, and to be fair, I was part of the...
Mr. McGuire, can we get to the question?
There's a question coming. I'm saying to them, we're hearing from the industry that this is Julu in certain products, and they're getting it from those brands, and they're saying, no, we're getting it from the store over here, we're getting it here, we're getting it here, we're getting it here. So the availability is everywhere, and from their malls, they're saying the flavors is what's enticing us. That's what's causing us to smoke this stuff. So how do you... The information we're hearing from the industry is different than the information we're hearing from the actual youth and students on the ground. So how do you balance that?
Mr. David.
So I agree with you. I mean, I think that, youth uptake and access is absolutely a major problem. We need to do everything that we can as an industry and government and policymakers to prevent that. Flavors, adults enjoy flavors. They're a critical aspect of vaping as a harm reduction technology. It's no surprise that youth also like flavors. Now, there's a bit of a difference when you say they like flavors and they use a lot of flavors, and that might even be one of the more, one of the attributes that they appreciate of it. But it's not necessarily the actual driving factor of uptake. There are a lot of, this is a complex issue, there are a lot of areas where peer pressure, just experimentation, rebellious behavior. There's a lot of reasons why youth might want to experiment with this technology. And being that it is relatively new, it is something that, especially with as many places as are right now, we should have expected. I think right now the important piece is to recognize, okay, that we have a challenge, but how do we approach this challenge in a way where we continue to provide access to adults who rely on these products to stay off of tobacco while protecting youth? And banning things or restricting flavors, which are key components of the product, is not the right approach to do that. And I think there are definitely alternatives.
Thank you very much, Mr. David. We're unfortunately out of time. We'll move on to Mr. Sherwin-Edwards. And just to the committee, as Mr. Edwards is coming up, we do have one, or I guess a couple documents that you should have before you, written in by Wesley Townsend, Melanie Crow and Rosemary Boot and Anthony Chiquetto. And again, a reminder to my colleagues, because we have so many today, we're limited in time, and so please get your questions quickly, because we're here to hear from the public and not from ourselves. Great, thank you. Mr. Edwards, the floor is yours.
Good morning. First and foremost, I'd like to thank the chair and the committee for allowing me to speak to amendments on Bill 233 this morning. My name is Sherwin Edwards. I'm speaking on behalf of Rights for Vapors, which is a loose collection of advocates and volunteers dedicated to the advancement of evidence-based discussions on vaping. Rights for Vapors is comprised of academics, consumers, and business owners alike. Our recent data surveys of over 5,000 consumers shows that 98% of vapers transitioned from deadly tobacco consumption using flavors and a variety of nicotine strengths. These elements, as well as cost effectiveness, are extremely important factors. The potential benefits of vaping to transition combustible tobacco smokers to a far less harmful alternative have shamefully been left out of the conversation. This brings me to Bill 233, which unquestionably needs serious amendments if public health is really the main objective. Let's talk about taxation. Vaping is not smoking and should not be subjected to heavy-handed taxation as is proposed in Bill 233. You know, we have to ask ourselves the question, you know, taxes, excise tax, AKA sin taxing, so it's a sin to smoke. You're taxed to smoke in order to try and create lower consumption, but is it also a sin to transition away from combustible tobaccos? This is a very important question. It is not. We understand that the availability and rights of adult vapers are being weighed against that of youth vaping. Let me assure you, we do not, absolutely categorically do not support youth vaping. However, these policies we're proposing will do little to combat it. An overall flavor ban was written into a recent piece of legislation, which also should absolutely be rescinded, or at the very least, exceptions should be written into Bill 233. We already know that tobacco-related illness contributes to the deaths of approximately 43,000 Canadian citizens every year in our country. 1,700 of those citizens are right here in Nova Scotia. There was a new report issued on Wednesday, February the 13th, by the Canadian Constitutional Foundation that outlines possible avenues for constitutional challenges to present and future vaping regulations. Proposals like flavor bans, nicotine caps, and restrictions that infringe on adult smokers' rights under the Canadian Charter of Rights and Freedoms. We should not need to go down the legal pathway of court challenges in order for the Canadian Constitution and Charter of Rights to be respected and upheld. Legislators should be responsible and do the right thing without needing to be told they are failing to respect the Canadian Charter of Rights as it is written. In 2015, Nova Scotia preempted, or 2014, Nova Scotia preempted the federal government as far as regulations are concerned for these products. That being said, in 2018, the federal government brought in formal regulations and protocols via Bill S5, and we ask that you follow Health Canada's framework and guidelines. Vaping products are not tobacco products. Today, you'll be hearing from many people who have quit smoking and transitioned to vaping, and they will outline the importance of flavors and also likely bring forward studies and evidence which sadly appears not to have been taken into consideration. These are your citizens, these are your constituents. Their voices should be heard and taken into account when amendments to Bill 233 are brought forward. If you really want to put an end to combustible tobacco use, you have the most revolutionary tool at your disposal: vaping. I encourage you to think about these issues and the age of the industry when you're considering changes. Think about what happens to an industry that has not yet been able to meet its maximum potential for public health.
5 minutes.
At the very least, think about those who it has helped. Thank you for your time. I'll answer any questions you may have.
Thank you, Mr. Edwards. Ms. LeBlanc.
Thank you for your presentation. I'm just wondering, I have lots of friends who have transitioned from cigarettes to vaping, but ultimately, with the people that I know of, you know, the idea is that eventually they'll stop vaping and then they'll be done with nicotine altogether. I'm wondering if you know of programs in the vaping world, in the culture where that is the target, so that vaping is a step down from cigarettes, but then eventually the goal is to stop vaping altogether.
Mr. Edwards.
These products were created with that goal in mind. And this is where the variation of nicotine levels are very important. What it does is it allows, as far as programs, I feel that the vape shop, the specialty vape shops, are the best at being able to take care of the consumer and walk them through the transition and walk them through the weaning themselves off of tobacco. Going from, may it be when they're initiated to the product, 35 milligrams or whatever it may be that particular individual needs, and then walk them through the weaning process. I personally have an outlet in Ontario, and my staff is very focused on bringing the end user's nicotine consumptions down to zero. I had a young man come in the other day, and while we're on the subject matter, was more than happy, and he said, I'm 7 months and I'm down to 1.5 milligrams of nicotine, and I want to work my way and transition to zero. That is the objective, that is the goal of these products. Now, quit vaping programs. There are none as of yet that are put in place, but they would be welcomed.
Ms. Roberts.
Thank you. I appreciate that many of the witnesses appearing today share the objective of preventing youth from taking up vaping. However, I don't believe that is the objective of the manufacturers of these devices. 35% of Juul is currently owned by the company that was known as Philip Morris Tobacco. And so I think that there are different forces in this discussion. Can you explain to me your organization, does it include the manufacturers of these devices?
Mr. Edwards.
Rights for Vapors is a group of consumer advocates. We are not involved with Big Tobacco. Big Tobacco, in essence, does not, contrary to popular belief, does not own this industry. This industry was created by individuals like myself and others that you will likely hear from today who brought this industry to where it is today. It is not owned by Big Tobacco. The organization that I've chosen to speak for, I have chosen to speak for because they are putting the consumer first. The consumer needs to be part of this conversation. If we keep pointing and going, oh, well, it's tobacco, it's the big tobacco companies, that is not true. Yes, Juul, yes, Vype, and other tobacco companies have come into this segment following legislation in 2018, but they did not build this industry, and they do not run and control this industry.
A few seconds left. Quick one, Mr. McGuire.
So I start a vaping business tomorrow, and nicotine is a drug. Let's be honest here, and there are side effects to nicotine. What kind of health training do my employees get to be able to give this drug to people that come in? So is there a formal program in place for people that work at a vaping shop, where do they get their information to determine what is the amount of nicotine people should be smoking? Because you said that when people come into vape shops, you essentially are prescribing to them the amount of vape or amount of nicotine they should be smoking. So is there a healthcare professional background? What kind of training is given to those individuals to ensure that they're giving the right amount and that there's no side effects?
Mr. Edwards.
Well, presently, we're self-regulated, and there is no program in place to train these individuals. I could talk personally, my employees are trained by me.
What's your background?
My background is I'm one of the pioneers in this industry since 2011.
Mr. McGuire.
I am not a doctor, if that's what you're getting at. And also medical professionals need to start getting the proper balanced information in order to be able to direct their clients and their patients towards this pathway of an alternative.
Thank you very much, Mr. Edwards. We all appreciate that you coming in today. Ms. Jody Allen. Oh, Mr. Jody Allen. Mr. Allen, the floor is yours. 5 minutes and 5 minutes.
Good morning. Thank you for speaking today, or for allowing me to speak today. I am Jody Allen, and I'm pleased to be here. I'm the general manager of Nova Scotia's largest vaping product retailer, the 14-store chain The Vapor Trail, with locations throughout Nova Scotia. I'm also the Atlantic representative of the Canadian Vaping Association's Board of Directors. Founded in 2014, Canada's leading industry representing over 300 manufacturers, distributors, and retailers. The Canadian Vaping Association has no affiliation nor receives funding from any tobacco companies. We are the only vaping association that has scheduled quarterly meetings with Health Canada to discuss policy and provide recommendation to government to better regulate the vaping industry in Canada. Some of our key proposals include the implementation of a dual age verification process for online sales, ban national brand-specific advertising in non-age restricted environments, limiting nicotine concentration to 20 milligrams per milliliter, strengthen border control to prevent illegal black market non-compliant products from entering into the mainstream market, and the creation of a GMP standard for e-liquid manufacturing to Health Canada. The Vapor Trail and Canadian Vaping Association are here to express our absolute opposition to Bill 233, and more importantly, the ministerial decisions affecting flavors and taxes that have been made. Together, the flavor ban and per milliliter taxation model will wipe out the adult-only vape shops in Nova Scotia. Already, shops have begun to close. If nothing changes, we too will disappear, as will the taxation income. Let me start by restating the CVA position that vaping is for adult ex-smokers. Youth should not be vaping, period. Adults who don't smoke should not be vaping, period. Vaping is a proven, effective harm reduction tool that helps smokers to stop smoking cigarettes. Already, tens of thousands of Nova Scotians have quit smoking by using vaping products. Essential to the migration away from smoking tobacco is the introduction of flavored e-liquids. Logically, if the only flavor available is tobacco, ex-smokers will return to cigarettes. Flavors make up approximately 94% of our product sales. Tobacco flavors are used to transition smokers away from cigarettes and not thereafter. The youth vaping surge that occurred across North America in 2017 and 18 should be a concern to lawmakers. It certainly is for the CVA. We have been working with governments across Canada to take practical steps to stop and reverse the surge in youth vaping. All evidence shows that the youth surge coincided with the introduction of stylish, closed pod, high nicotine vaping systems being introduced by tobacco-related companies and made available in thousands of convenience stores across the country. The youth get a nicotine buzz and quickly become addicted. To speak to Mr. McGuire's initial question, there are 930 gas stations and convenience stores in Nova Scotia, and in December there were 67 adult-only vape shops. That number does not exist today.
1 minute.
Interestingly, in the UK, where nicotine levels are limited to 20 milligrams per milliliter, and thousands of flavor profiles are available, there has been no youth surge. Other provincial governments are taking action to stop the youth surge. They are limiting the amount of nicotine in pod systems to only 20 milligrams and eliminating all flavors in the convenience store channels where youth have access. Instead, these leaders have designated adult-only expert vape shops where the vast majority of sales must be from vaping-related products as the only venues for adult ex-smokers to continue to get flavored e-liquids. As well, some provinces are introducing new vaping taxes to help fund education and enforcement. The CVA agrees with the changes introduced by the governments of British Columbia, Alberta, Prince Edward Island, and Ontario.
5 minutes.
Almost done. Nova Scotia seems to have forgotten adult smokers that have transitioned to vaping as a less harmful alternative in developing these policies. Tens of thousands of adult Nova Scotians have used flavors to help transition away from combustible tobacco. The decision made by the Nova Scotian government to eliminate flavors will destroy the adult-only vape shops that are in this province, and the exuberant taxation policy of a per milliliter tax, the highest this country has ever seen, will penalize those who are trying to quit smoking by choosing a less harmful alternative. These policies favor the tobacco industry's highly addictive, low-volume, closed pod systems and do not discourage youth uptake at all. If Big Tobacco designed a vaping control policy framework to advantage themselves, they could not have done better than what Nova Scotia has done. The policy wipes out the adult-only vape shop network, eliminates flavored products from adult ex-smokers, driving them back to smoking. It taxes e-liquids by volume while ignoring nicotine potency and drives all vaping-related traffic through the convenience store channel where they have financial control over their retailers and no harm reduction expertise available. We know that Nova Scotia wants to be a leader on the youth vaping policy agenda. We would like to work with the government to develop such a policy. The current path is a disaster for ex-smokers and small non-tobacco retailers. Please set aside Bill 233 and delay the introduction of the April 1st flavor ban and sit down with our industry to develop a workable policy framework that will do what we all want it to do, which is to stop youth from accessing vaping products while ensuring that more adult Nova Scotians can quit smoking. In closing, vaping is a valuable harm reduction product in Nova Scotia used by tens of thousands of adults. The bill will do the opposite of what the government intends. It will drive people back to smoking. The people of Nova Scotia deserve better from their legislature and their politicians. Let us hit a pause button, look at best practices and legislations elsewhere, and pass a vaping policy that works. Thank you.
Thank you, Mr. Allen. I think we have time for one question and answer. Mr. McGuire.
For your question here today. Quickly, I would argue that when you talked about gas station to vape shops, there's more vape shops in my community than there are gas stations. So if we're talking about access, the access is. Secondly, I will ask you the same question that I asked Mr. Edwards. So you represent the largest chain of vape shops. What professional training are your employees getting from a healthcare perspective to be able to prescribe essentially what's happening here, nicotine to people that come in? And how are you verifying, because you said that it's just this product is just for ex-smokers. How are you verifying that this is just ex-smokers? So how are you verifying there's just ex-smokers, and what universal program does the vape industry have if they hire, say, Mrs. Roberts to come in tomorrow to work?
Mr.
To
Allen.
ensure that they're prescribing the right amount
Mr.
for
Allen.
that person.
So for our company, our initial introduction for all of our employees contains an 87-page employee manual. There are separate manuals that go with that depending on the person's role within the organization. Those manuals have been developed based on Health Canada's available research through the Royal College of Physicians, the CDC, and what we've had available at our disposal to develop those. As far as how do we determine what nicotine concentration a customer should start consuming when they walk in, the reason that adult-only vape shops are imperative is because we spend at minimum 30 minutes with every single new customer who walks through our door. We ask them how long they've smoked. We ask them how much they've smoked. We do endless probing in order to advise that customer where they should start. It is not a black and white scenario as your questions may suggest, because addiction is not a black and white scenario as your suggestion kind of points to, sorry. It's a very complex personal experience for every single person, and for some it has amazing success and for others it does not. You're very welcome.
Thank you very much,
Yes,
Mr.
course.
Allen. Yes, do you have a copy of your presentation?
Can I take one and pass it around? Thank you very much.
Thank you for coming in today. Next is another Jody, Jody Howe. Is Jody Howe here? We're basically right on time. Let's move then. Would there be an Eva Campbell? Good morning, Ms. Campbell. 5 minutes for presentation, 5 minutes for questions, but you can exceed the 5 if you wish. The floor is yours.
Thank you for allowing me to speak. My name is Eva Campbell, and I own the N Vapor Shop in New Glasgow. I am one of over 60 shops in Nova Scotia that will be forced to close in April if you don't reconsider your approach. Removing 90% of the products I sell will, in effect, close me down. So since I won't be a business owner beyond this month, I'll speak to you also as a vapor. After smoking for 35 years, 10 years ago I became a vapor. From the start, I vape flavors. I've been all over every aspect of this industry, at one point even making my own e-liquid. So it's not my first rodeo. In most of those 10 years, there was never a real problem with children. We weren't on youth radar. So what happened in the last couple of years? Flavors? No. Like I said, I've been vaping for 10 years and I've always vaped flavors. Most smokers start with a tobacco flavor, but soon demand more variety. The demand was in direct response to adults who, after quitting smoking, did not want to vape anything that tasted remotely like a cigarette. Thousands of flavors long before these last few years. So what happened in the last year? Big tobacco happened. Mind you, from the beginning, people opposed to vaping, the quit or die people, were under the impression that it was a tobacco product, and we were big tobacco. In 2015, when the Liberals tabled a bill to ban flavored tobacco, they were caught with their pants down when we pointed out that there was, and always will be, zero tobacco in our products. We all know how that turned out. I have the word tobacco on my door of my shop, and it irritates me because I have no tobacco inside my shop. So mid-2018, Juul entered the market with a discreet device with minuscule capacity that delivered ridiculous amounts of nicotine, pre-filled and disposable. I vape 12 to 18 regular nicotine in an open refillable device. On average, the device holds 2 to 4 milliliters. The most common bottle of juice is 30 milliliters and most times 60. The taxation proposed will more than double what an adult pays for his e-liquid. Juul, on the other hand, came out with 59 milligrams of nic salt. Not thousands of flavors, 4. Their pods hold less than a milliliter of e-liquid, so the price increase for the pack of pods would be less than $1.50, whereas mine would more than double. I know this might be all over the place, but if you're trying to regulate an industry when you don't know how it works, you're going to fail. Before you regulate, you must know how it works. I can't explain it all in 10 minutes. This is also why government needs to consult with the industry before they push regulations. Justifying this type of ban by saying youth prefer flavors is hardly based on science. All living beings prefer flavors. Give a dog the option of a piece of bacon and a piece of crap. He will go for the bacon, but when the bacon's gone, you see where I'm going with that. The children aren't vaping Juul for the flavor. Juul pulled their flavors in the US and their stock still rises. There's a very simple, straightforward way to address youth, because the youth aren't vaping what I vape. Cap the nicotine content. I've never sold anything over 18, and 7 years worth of adult customers did just fine. If they don't get the head rush from 59 milligrams, kids will put it down and move on.
1 minute.
Have only tobacco flavors available at the same point of sale as traditional tobacco cigarettes. Most smokers start with a tobacco until their taste buds come back. Restrict flavors beyond that to adult-only vape shops. No one under 19 steps foot in my shop. I actually have a reputation, and kids, young people, have their ID in their hand when they walk through the door because they know. This limited capacity thing that sort of blipped in there for a second, I'm not sure how that will affect the youth uptake, since what they vape now holds less than a milliliter of juice and is disposable. What adults use are refillable, larger capacity, so it's not so much work. It also makes stepping down your nic content easier.
You're at 5.
These are simple things, but they are things that will have a direct impact on youth vaping. Banning flavors will have zero effect. Making it illegal for adults will not stop a kid from doing something illegal. Limiting the capacity of a device will not affect what the youth are vaping. It will just make it more difficult for adults. Most of my customers are over 50, and they're proud of that they quit smoking. Making it impossible for our seniors to get vaping devices, and they'll just go back to smoking. It's just too easy to get a cigarette on every street corner. Seniors in particular need the vape shops. They are not online and they're not tech savvy. They need instruction and encouragement. I have a 78-year-old customer who, after a month of trying different flavors, she quit smoking, and her favorite flavor is gummy bear. She was in tears when I told her about this ban and that her $20 bottle will soon cost her more than $50. Without flavors, I'll go out of business, period. No vape shops are going to survive with one flavor. No juice companies are going to survive making only one flavor. Banning flavors will only push people back into smoking and open up a black market, and no one wins. Not the kids who are already getting this illegally, not vape shops that will shut down, not adults who have quit smoking with this alternative. You know who does win? Big tobacco. Juul, 35% owned by Ultra. Vape, 100% owned by Imperial Tobacco, and Logic, it's Japan Tobacco. Since they sell mainly in convenience stores that sell hundreds of other things, they will be the only ones able to survive a flavor ban. And even if vaping dies, they'll have tobacco cigarette sales to fall back on. They win either way this plays out. I urge you to take the direction from the Canadian Vaping Association and put in real regulations that will address what you're really trying to accomplish, which is getting the youth off it. Thank you.
Thank you very much, Ms. Campbell. Ms. LeBlanc.
Thank you for your presentation. I've heard now from you and from the person before you compelling arguments about, or compelling information about Juul and big tobacco. So do you sell those? You don't sell those products in your, and those products are only available, are they available in some vaping shops or only in convenience stores?
Ms. Campbell.
In some, I'm sure. For me, as soon as I saw it on the market, no. I didn't go near it. I didn't go near the Nick salts, which are a patented technology from Juul. It was unnecessary. I've been vaping 10 years. I've been in business 7 years. I know what works, and it's that much nicotine is absolutely unnecessary.
Ms. Smith-McCrossan.
I just want to say thank you for coming today, and I appreciate your candid stories and your personal experience. It's much appreciated. And also, I really appreciate the fact that you're bringing solutions and ideas of where you'd like to see legislation amended. So I just want to thank you for that.
Ms. Sorry, Ms. Campbell.
You was consult with us, and they did not.
Ms. Roberts, a quick question to finish up.
Thank you. You referenced the Canadian Vaping Association, Mr. Allen, just directly before you spoke from them. Do you feel like you are represented by the Vaping Industry Trade Association or by Rights for Vapors, or is the Canadian Vaping Association where you would direct us to?
Ms. Campbell.
The CVA is just an advocacy group, and Rights for Vapor, yes. Because we're in the industry and we know what it takes, what will work to get the kids off, because we know, because we're not. You have to ask, you can't ask the dog catcher to regulate the construction industry, okay? You have to know how this works, what it does in order to put anything forward that's going to work.
Great. Thank you very much, Ms. Campbell. We appreciate your perspective and the information you've shared with the committee. Thank you. Next, Conlan Henniger. Good morning, Mr. Henniger. Welcome. The floor is yours, 5 and 5.
Thank you. So I started smoking at the age of 15. But it wasn't until the age of 19 that I was able to vape. By the time I was 16, I was up to a pack a day. Vaping really changed my life, because if I had never picked up vaping, I would still be smoking generally a pack a day, if not more, right? And it took a quick transition. It took about 2 weeks from the time that I first picked up that vape that I stopped smoking. Now imagine in 20 years, if I'd still been a pack a day, I could be dead. I could have lung cancer. I could have further health issues, you know. The difference in health is absolutely drastic as well. Like, I can breathe. When I worked out every day, I was in the military when I was younger, but I still couldn't breathe. I smoked, my fingers stank, and I just was not 100% in health, correct? I hurt my back a few years ago, so this made me unable to work out still to this day, but I can run. I can run as well as I could when I was still working out every day. And I have vaping to definitely thank for that. Now, I want to address the impact that these two bills will have on our industry. I've been working at the Cloud Factory in Dartmouth for over a year now, and it's been probably the best job I've ever had, to be honest, because I really get to help people get off tobacco. Now, if you ban flavors and you tax us by 50%, we will close. There's no way around it. There's no secondary choice. We will close. We will have to open as another business. There will be no vaping, correct? And this is all to protect the youth. I don't see any positive outlook in banning flavors as well as banning by 50%. or not banning, but taxing by 50% e-liquid, correct? Now, stores are already closing. We will soon close come after the ban because nobody will vape flavorless, nobody will vape tobacco. Over 95% of our business is flavors. As Ava Campbell said, it's typically just starting off that people will vape tobacco. I bought one bottle, I walked in, it was my first bottle because I walked in and said, I'm back a day, and they sold me the tobacco, I vaped it, it tastes like sweet dirt. Tobaccos are disgusting. I like my menthols, I like my fruits, I like custards, candies, everything, right? I've been making e-liquid for 2 years, and that's what 95% of our sales are, flavors. The majority are in lower nicotine strengths, but you see if there is no flavors and an extra tax, we won't be able to sell anything. Will be 5% or less, and it'll just be pushing people towards a black market. Ordering online, I know that the federal government has been talking about introducing a law saying that you're not allowed to order interprovincially, but people will find a way. You know, what's stopping thousands of bottles of e-liquid coming from Ontario or the United States that already come through, correct? And when it comes down to it, this industry will be destroyed. I'm not sure if all of you are aware, but the film industry was taxed by roughly 300%, if I'm not wrong, and now there is no film industry in Nova Scotia. And I see the exact same thing happening to us. And also, if this goes through, vaping has saved thousands of our lives. You know, the health difference, especially in the long run, imagine, 20 years down the road, if vaping is still banned, you will be sentencing us to death. I will die. Most smokers, I think it's 65% of smokers in the long run end up dying from smoking-related illnesses. And one big point that I want to talk about is proper regulations. Such as everyone else has said, there are proper ways to go through this without banning everything that our industry has. Like permit of sale. So with alcohol, restaurants need a permit of sale. Tobacco shops, convenience stores, everyone needs that permit of sale to sell tobacco, alcohol, certain other vices per se. So I believe that we should implement certain permits, and Mr. Maguire, you've been talking about certain training programs, things like that, that are regulated by law. I think that those should be implemented. A tax bracket, we could eat 10 to 15%. That would be reasonable. 50% would not make sense. ID scanners at the door is another thing that we've talked about. Not that I love kicking out kids, honestly. It's pretty funny because they walk in, they're very confident on getting their 50 milligram or 35 milligram, nicotine salts. But, it's just, and they're out the door. A nicotine cap lower than 66 milligrams of nicotine in Canada. I believe that is the legal limit is 66 milligram. Juul does 59 milligram. Stealth, Fight, Bow, Logic are the other pre-filled pod systems. They do 50 milligram. I believe bringing it down to 35 or even 25 milligram would still have a high success rate as far as helping people quit. Youth access is a massive point that I want to talk about, right? Because when I was underage to buy cigarettes, I would wait for my 16-year-old buddies or whoever was working at the gas station. You walk in, you show your ID, all confident. As long as the cameras see it, they're selling you their smokes. And when it comes down to it, how is a 16-year-old kid being stopped from selling cigarettes or vapes in the convenience stores when he's not allowed to work in my store, right? And I think that's a big access point is gas stations and convenience stores. It's what most of the kids use. It's that stealth device. It's very, very easy to conceal much higher nicotine strengths. They're trying to get high off of it, right? It's a buzz. It's a nicotine buzz. It's what we all started with when we first picked up that cigarette. And also, there's an $1,800 fine for selling underage kids nicotine, whereas in the liquor store it's over $10,000. You get fired from your government job. Why is that not comparable? Why is it still only an $1,800 fine to incentivize that, there's an absolute no way that people will want to give access to the youth? Not that most shops do. I'm sure 95% of them don't, but in the case, or say the kids working at the gas stations, give them a $10,000 fine or anyone buying for it. I know that there's a recent law implemented so that the police can take away vaping products, or I think that's coming soon, correct? And I definitely encourage that. In no way, shape, or form do we encourage that youth vape, and that's what this whole subject breaks down to. So, there's a few different aspects that we can look at it. But when it comes down to it, this is just creating a black market. People make e-liquid. I've been making e-liquid for over 2 years for personal use. It's not hard to order things online, you're just creating a black market. It's as easy said as done. And flavored alcohol. Why are we not compared to flavored alcohol? Because if I'm not mistaken, there's more kids that have tried alcohol than have tried vaping in the past year in Nova Scotia. So there's Pop Shot, which is 7.5% alcohol, and then there's our 0 milligram, which might look the same, but you need to be 19 to buy both. But when it comes down to it, when I was a kid growing up, everyone was getting drunk on the weekends, but not everyone smoked, I just want to reiterate a few points, just the mass impact that this will have on the industry. It will destroy the Nova Scotia vaping industry. We need proper regulations. Sit down with our industry, we can talk about it, and we will figure out the proper way to get vaping out of the kids' hands while still having access to our adult ex-smokers and vapors. And yeah, that's pretty well everything.
Okay.
Thank you.
Thank you very much, Mr. Henniger. We've got time for one quick question, a minute to go here. Ms. Roberts.
Thank you. Can you share if at your shop do you sell Juul and the other pre-filled pod devices?
Mr. Henniger.
So we don't sell Juul or anything owned by Big Tobacco. We actually do a trade-in program for anything owned by Big Tobacco for the Canadian counterpart. It's called Stealth. It's the same idea. It's a pre-filled pod system, but there's many more flavors. It's all owned by a Canadian vaping company, and typically people start with a higher nicotine strength, 50 or 35 milligrams, but as they transition down, it will go to 20 milligrams and then move down. So,
thank you very much, Mr. Henniger. We appreciate you coming in today. Just check back and see if Jody Howe has arrived. No? Okay. We'll continue on then with Margaret Preston. Ms. LeBlanc.
I'm finding this conversation very compelling and important, and I think it's a very serious issue. I'm wondering if you could reiterate to our guests the system of how the time works, because I feel like if there was time allotted, I would have many more questions. I'm wondering if you could just sort of re-explain that, just to make sure everyone understands what's going on.
Sure, happy to do that. So, and some people have walked in the room since the beginning of the meeting. So we have a total of 10 minutes. We're trying to allot 5 to make the presentation, so we have 5 minutes for questions. But again, it's up to the choice of the presenter if they want to exceed that 5 minutes. And I do my best to give a warning to folks to know where we are in the timing of things. So welcome, Ms. Preston. The floor is yours.
Thank you.
Oh, excuse me. Sorry. Mr. Johns.
Yeah, thank you very much, Mr. Chair. And I just wanted to follow up on that question. So it's 5 minutes to present with 5 minutes to follow up for a full 10 minutes?
Correct.
Okay, just for my clarification, during other proceedings here, when we hear from the public, what are the time frames for that?
We try to do 10 and 5, but
yes,
with the number of presenters that we have here today, we've got 5 or 6 hours of presenters here, so we've chosen to go 5 and 5.
Okay, so if I could, Mr. Chair, just for the record, I'd like to just put on the record that I wonder whether or not in this particular case it's fair to the people that have come here that are presenting, that in this case we're eliminating 5 minutes from each speaker, but in most normal cases of hearings that come before here, we have the 10 and 5. So I just want on record that I do object to the fact that we're restricting speakers by 5 minutes. Thank you.
Thank you. Ms. LeBlanc.
Recognizing that this is all taking time, I want to agree with my colleague. You know, if, in my opinion, law amendments is the purpose of it is to hear from the public. If the public needs to talk for hours and hours and hours, we should be extending law amendments. We should be extending our days of the legislature to make sure that bills are passed with proper scrutiny. So I also agree. I kind of didn't realize, because this is my first time actually officially sitting on law amendments, so I also want to register my objection and suggest that we revert back to the 15-minute usual time frame.
Thank you. Thank you. And I just did clarify with our alleged counsel that this procedure of 5 and 5 has been used many times in the past when we've had long lists. Yeah, thank you. All right, so we're back to Ms. Preston. The floor is yours.
Good morning, and thank you very much for hearing from me. I wrote a speech, and I'm very nervous. Okay, thank you for allowing me this opportunity to speak, and I hope you will allow me to address all of the recent legislation regarding vaping regulations. I will keep it short and hopefully to the point. Let me begin by saying I'm absolutely opposed to the youth being able to purchase vaping products, and I agree that suitable measures must be taken to ensure that vaping products are reasonably restricted. At our specialty vape shop, the first brick-and-mortar store in HRM, established in 2013 by my now deceased partner, Kyle Kurtz, we have not only always complied with regulations, we started them by restricting store access.
Excuse me, Ms. Preston, it's a bit hard to hear you, so I'm just wondering, you might just pull your mic a little bit closer to you, and we'll see if that helps.
Okay.
Thank you.
Okay, where was I? We started them by restricting store access to those 19 and over, and stand by the increase to age 21 if the province so chooses. We have come under fire by customers who get upset when we will not allow them to bring their children into the store, even when accompanied. That said, we have always considered ourselves an adult-only shop, and we believe that adults should be able to freely access products of their choosing. Vaping has been proven to assist adult smokers in moving into a less harmful manner of dealing with addiction. Flavors are one of the enticements for steering away from tobacco while still providing the psychological crutch of hand-to-mouth smoking that is as much a part of nicotine addiction as the nicotine itself. Eliminating flavors will effectively close down our stores, but worse, will open up unsafe product in the black market. For those who think the black market and unsafe product doesn't exist, allow me to tell you that the founder of my company, Smokeless, died as a result of an accidental overdose from depression. The overdose consisted of fentanyl and heroin, both of these being obtained from the internet black market and readily available, delivered to his door, in fact. The black market exists and will be spawn unsafe product. We have recently been legitimized by Health Canada insofar as regulations have been implemented, and we stand by them. Big Tobacco, a co-owner of the Juul Pod system, which we now refuse to carry, was particularly responsible for making vaping so attractive to minors by advertising on TV networks such as Nickelodeon and the Cartoon Network, both of which obviously cater to youth. We have agreed to remove dessert flavor names of juices. We agreed to package design, health warnings, and ingredients. We do not agree with the removal of flavors. Presently sitting at more than 70% of our sales to adult users, and we do not agree with unfair taxation. I'm here today to ask you to reconsider the 50 cents per milliliter tax to a percentage tax based on the retail selling price. While we don't agree that a harm reduction item should be taxed, we do agree that a percentage tax is more fair and the best way for the province to collect fair tax dollars to pursue further youth education into the risks associated with youth vaping. If the tax goes through as it is now tabled, it will make the cost of e-liquids prohibited to lower-income individuals, as addictions are on an outlet for stress. And can we imagine a bigger stress than not having enough money to make ends meet? We need to make this less harmful experience available to current smokers, especially those who can barely afford it. From my personal experience, I can tell you that I was a lifelong smoker and now I vape. A flavor, and for the last 5 years, I feel better and truly believe it is the lesser of all the addiction evils. Before I finish, I can also add that youth access is the biggest issue, and I believe that all tobacco and vaping products should be removed from gas stations and convenience stores and only available in specialty shops where we can ensure we are compliant. Youth will always be rebellious, so access should be the starting point, not the flavors.
1 minute.
The UK doesn't have the issue we have with youth uptake. We should be looking at them as a model. As part of voluntary compliance issues and a head start on expected compliance, allow me to assure you that Smokeless has done the following as it relates to youth vaping. We took down all our social media sites because the youth could see it. We do not advertise, period, in any form, social media, print, radio, or TV. We made our website static with no online ordering available. We removed our discount program to comply with no points of sale ads or promotions. We ID everyone who appears to be under the age of 30. We do not allow minors, even if accompanied, into our stores at any time. We have removed all product from the shelves that do not meet Health Canada standards. And we agree with nicotine cap limits on the product. In short, we agree to every measure being taken with the exception of the flavor ban and the unfair taxation of product. Thank you very much.
Thank you very much, Ms. Preston. If you'd like, I'll arrange to have copies of your presentation for the committee. Ms. LeBlanc.
Thank you. I do a lot of work around issues around poverty in my role as an MLA, and I hear a lot of times people talk about poverty reduction, and I reject that term. I think that there's no amount of poverty that is okay, and to reduce it is great, but we need to eliminate poverty. And when I hear about harm reduction connected with vaping, I feel the same way. It's great to reduce harm, but it's more important to eliminate harm. And so I guess I'll go back to the question I asked someone else, is that what is the plan? When I hear your presentation, again, I find it compelling, but I also think that like any harm is bad, and we should be doing what we can as legislators to eliminating harm. And that's a big job. But so is when you talk about stores going out of business and going to the black market, I get that. It's worrisome, but is it true that the ultimate goal of vape shop owners is to eventually put themselves out of business because everyone gets off nicotine? Would you say that that's true?
Ms. Preston?
Thank you. Yes, eventually we want everybody to get off nicotine or any addiction that you would have. There are so many people that smoke in this province alone. My dad, I've come from, both parents smoked. I smoked my whole life until the last 5 years. I will eventually get off the vaping. Will I still sell it to people who are smoking to get them off smoking? I would hope so.
Mr. Johns.
Yeah, thank you. So having been in your shop, because that's where I buy my e-juice, one thing I noticed, so if you could clarify, you keep track of everybody through a database who purchases, do you? Yeah. And so what would the average age of the consumers who purchase products in your outlet be?
Ms. Preston.
Thank you. In my establishment, most of the people are my age. I'm 56 years old, and most of them are smokers that have smoked for over 30 years that we're helping to get off of smoking altogether.
Mr. Johns?
Do you sell any of the closed pod systems like Viper, Jewel, or Stealth, or any of those? Do you sell those?
Ms. Preston.
We sell the Stealth pods, yes.
Mr. Johns,
Thank you, Mr.
I
Chair.
have no other hands here, so I'm letting you go.
Yeah, thank you. And if there's anybody else, I'll certainly step aside so that they can ask questions as well. And I missed, but currently, how many flavors do you actually sell at your store?
Ms. Preston.
I'm not 100% sure how many, but there's well over 30.
Mr. Johns.
Thank you. And of the 30 that you sell, what is the percentage that you sell that is tobacco flavored, such as classic tobacco or international tobacco or any of those flavored ones? What would that percentage be?
Ms. Preston.
I'm thinking it's about 5 or 10% because most of the tobacco flavors are used from when you first try to get away from cigarettes because that's what you want. You want a cigarette. Nothing else is going to pacify you. Eventually, you want to stay away from the tobacco flavors because you're trying to stay away from cigarettes.
Mr. Johns, we have a minute.
Thank you. And in addition to that, I'm also curious to know, it seems to me as if many people are lumping all vaping products into kind of one basket. Are there different things than like how many different types of devices are there? Bricks, the tanks, the coils. How many different devices are there out there?
Ms. Preston.
I can't even tell you the number. There's so many, but everybody's need is different. Everybody, what they want, like when I smoked, what I smoked is not the same as what somebody else smoked. So I have the hand and mouth addiction. It wasn't about the nicotine for me. It was about the agitation, the irritating kind of thing. That's what I was addicted to. My mom used to tell me I was a fake smoker because I didn't want the nicotine. I just wanted, I had anxieties, and so there's so many different devices that will suit individual needs, and that's what we have. We have different tanks, different sizes. Some people don't like trying to fill something up all the time, so they want something bigger, so you only have to do it once in a while. But the whole goal of vaping is to actually eliminate from vaping and smoking altogether. Nobody wants addictions. They just happen.
Great. Well, thank you very much, Ms. Preston.
Thank you so much
Appreciate
for
you coming
hearing
in.
from me.
Mr. Stephen McKay. Mr. McKay. Sarah Blades. Good morning, Ms. Blades. Welcome. You've got the 5 and 5 routine understood. That's great. And the floor is yours.
Good morning and thank you. My name is Sarah Blades and I'm a Prevention and Health Promotion Specialist with Mental Health and Addictions Program at the IWK Health Centre in Halifax. The focus of the work that I do is to address the social determinants of health that significantly influence mental health outcomes and substance use risk factors among Nova Scotian youth. This work includes influencing the policy environment in which Halifax's children and youth live, learn, and play. It is a pleasure and a privilege for me to appear today and speak in support of Bill 233 and the proposed legislative amendments to the Smoke-Free Places Act and the Tobacco Access Acts of Nova Scotia. The proposed amendments will strengthen support of smoke-free environments, pave the way for provincial regulation over highly addictive nicotine concentration limits in vaping products, and will begin to match enforcement over electronic cigarettes with other types of tobacco. This government should be applauded for the comprehensive approach it is taking on regulation, thereby reducing harms of nicotine addiction for youth, especially with respect to increased taxation, removing retail access to flavored vaping products, restricting nicotine concentration limits, and improving smoke-free environments. These important amendments will certainly contribute to healthier futures for our children and youth. When legislation reduces the amount of smoking in public places, the behavior becomes denormalized. For this reason, among others, it is important that the entirety of restaurants and patios remain smoke-free places. The amendment in the Smoke-Free Places Act clarifying the definition of a patio and closing related loopholes will sustain the protection for establishments as smoke-free places, not just for children and youth, but for everyone. Other environmental considerations include the social policy and marketing environments. In a recent study by Dr. David Hammond and colleagues, international comparisons of youth vaping behavior between 2017 and 2018 show that while U.S. and Canadian youth have increased regular vaping between the two time points, youth in England have not increased their vaping over time and remain at lower rates than the U.S. and Canada. Data from 2019, soon to be released by Dr. Hammond and colleagues, indicate that this effect continues to strengthen. In England, marketing is restricted and nicotine concentrations are capped much lower than what is permitted in North America. These findings reinforce the impact that strong regulatory environments have in reducing the spread of a youth vaping epidemic. Further success in reducing vaping harms can be achieved when we also consider the online environment. Increased marketing via promotion by influencers on social media platforms that youth frequently access is of concern. In late December 2019, Facebook and Instagram took a strong stance in banning influencers from advertising vape products on their platforms. The relatively unregulated online sale of vape products can be another access point for children and youth. It would be prudent for the province to consider the implementation of an online retail ban to ensure vape products are only being purchased by people over the legal age limit. The proposed amendments additionally provide a solid base for our government to regulate emerging nicotine delivery products. This is essential as the tobacco industry will very likely evolve product development to respond to consumer preferences and changing regulatory landscapes across the globe. This amendment language enables the province to be nimble in responding to new nicotine delivery products that may be enticing to children and youth. Medical experts concur that nicotine exposure has a severe negative impact on the developing brain. Early, regular exposure to nicotine predisposes youth for other addiction problems and concentration problems, among other challenges in life. Working in the area of social determinants of health, we know that educational achievement correlates with higher socioeconomic status. When a person experiences challenges in school because of addiction, impaired concentration, and other barriers, they are disproportionately impacted by poorer or insecure work opportunities, insecure housing, and poverty. In turn, disadvantages in these areas are correlated with poorer health overall. Nicotine addiction is not a habit, it is a treatable illness. Regulatory structures like these additionally reduce the burden on our social and dependence treatment systems. Attractive candy and sweet flavors are a key factor in youth initiation of vaping, and albeit the legislation has passed to reduce the availability of flavors in the market here, potent nicotine salt formulas of vaping liquid deliver a large amount of nicotine without the harshness of regular cigarettes, facilitating addiction to develop. The cost for 4 highly concentrated nicotine pods is significantly less than what the equivalent in 4 packages of combustible cigarettes would cost, making them further attractive to youth who are price sensitive. These products are readily available at gas stations, convenience stores, and grocery store tobacconists. Based on the current state regulatory environment, it does not seem difficult to understand why so many Nova Scotian youth, their schools, and their caregivers are concerned about increasing vaping rates. Amendments to the Tobacco Access Act, empowering officers and inspectors to confiscate electronic cigarettes, more accurately reflect the validity of the harms presented by these items. We support the non-punitive approach of confiscation and not charging children and youth. It is also our position to increase enforcement activities in the direction of retailers and specialty vape shops so that the burden is placed with the adults who are responsible for the sale of products under the Act rather than the youth who are using them. Finally, we also support strengthening the proposed amendments with concurrent bills, introducing higher taxation of vaping products and licensure for their retail sale, and the previously introduced vaping product flavor ban. According to recent local data, many youth who vape indicate they would quit if favored vape products were no longer available. You'll hear more about this from my colleagues later today. There is an international consensus that youth are very sensitive to the price of products. After implementation of increased cigarette taxation in Nova Scotia, rates of youth smoking plummeted. We look forward to similar success with the proposed amendments and the comprehensive approach tabled in the legislature.
You're just about at 5.
In closing, the IWK Mental Health and Addictions Program supports the proposed amendments in Bill 233. In making these changes, Nova Scotia would join a long list of jurisdictions that are taking direct, impactful regulatory action to protect the health of youth. Just recently, Prince Edward Island has implemented a restriction on the sale of tobacco products to people over the age of 21. The same has been applied across the United States. Strong legislative changes are being made on the west coast of Canada in British Columbia, including lower nicotine concentration limits and unique taxation structures. These are examples by which Nova Scotia and the rest of the country can be inspired to act. It is incumbent upon the IWK to improve and protect conditions for our children and youth to thrive. One of the ways we can do this is by enabling Nova Scotia's youth to grow up free from the impacts of nicotine addiction and to live long, healthy lives. Members of the Law Amendments Committee, thank you for your time, and I'm happy to address your questions.
Thank you, Ms. Blades. See if we can get 3 quick ones in here. Ms. LeBlanc.
Thank you for your presentation. Earlier, you said that you thought an online retail ban was important for Nova Scotia. Do you? Sorry, I just want to clarify. Do you mean like so that we don't allow any online sales in Nova Scotia, or do you mean advertising online in any way?
Ms. Blades.
Thank you for your question. We would support the restriction of online sales at all, but also marketing is very important to restrict when we consider children and youth. That is truly the success by which many of these sleek, pod-based, easily available products have risen, is through marketing, and so online marketing is very important, as I mentioned in the Facebook and Instagram move.
Ms. Miller.
Hi, thank you so much for coming in today. I was sitting in this chair in 2015 when the last legislation came forward, and then government actually did back down from restricting the vaping flavors at that time. And I would say that in my almost 7 years here, that's been my one regret. It's been the only thing that I regretted when you think about the tens of thousands of young people that are now vaping and vaping flavors that may not have been. I'm not saying they would have been smoking, but that would not have been. So I want to ask you how many youth do you think during that time have been impacted by this, if you have a number, and what that framework would look like today if that had gone through last time?
Ms. Blades.
Thank you for your question. Although I don't have numbers with respect to how many more youth would be impacted by tobacco today or less youth would be vaping, what we do know is that the majority of youth who, in a recent survey that you will hear about later today from another colleague of mine, most of the youth, female identifying youth, the thing they like the best is flavors. And the thing that entices them to begin vaping is flavors. So that's what I can say about that.
Mr. Commerce.
Thanks so much for your presentation. I know often vaping can be viewed upon as a smoking cessation tool. And I know, having worked in the healthcare field myself, many healthcare providers see it as replacing one nicotine addiction with another nicotine addiction. I'm just wondering if you could speak to that a bit, maybe with the research to support that.
Ms. Blades.
Sure thing, thank you. What we do understand is that there's a body of research around switching from combustible tobacco, absolutely, to vaping for adult smokers. But what we also know about youth vaping is that many youth who try vaping and who initiate vaping, who become addicted to vape products, have never smoked a combustible cigarette. So we know that there is the desired effect for vaping as a cessation mechanism is not happening for youth and young people.
Ms. Roberts.
Thank you. I wonder if you could be convinced that the combination of lower tobacco concentration or nicotine concentration and other measures such as restricting access to vape-only shops, maybe restricting the use of pre-filled pods, could accomplish the goals of restricting youth uptake of vaping, given that they seem to be primarily using small pods at high nicotine concentrations, or would you agree with that?
Ms. Blades.
Thank you. In my opinion, I don't believe that still permitting the flavors to be sold will be able to protect youth from that. So the reason youth, some of the reasons that youth are using these discrete pod-based, easy flavored devices are that they are accessible. And in the current regulatory environment, and even with these amendments, if we don't restrict flavors, they will still be available for retail sale. Chances are, young people will know someone of legal age who will purchase those products. The peer-to-peer market is very strong, with respect to the sale of vaping products. So, for example, if I want a new Juul, I might post mine on Instagram for sale for $20 and sell it and buy another one, or whatever it is that's going to happen. So that not eliminating flavors from the market provides the risk is still there for young people to get them from other sources. And so we would agree that the best approach would be to remove them from market, arguing that the convenience of adult smokers who do enjoy flavors is not worth the risk of enticing children and youth to become nicotine addicted, just as we saw with the tobacco industry in the 50s.
Thank you very much, Ms. Blaze. Appreciate you coming in. Just before we move to the next presenter, the commissioners have informed me, asked me to ask people who have finished presenting to return their presenter passes downstairs, as we have more people wishing to speak and a limited number of presenter passes. For those of you that are interested in returning, there are some second floor passes that you could exchange for and come back to the room. And if we exceed our fire marshal capacity, we will turn the TVs on downstairs so people can observe the proceedings there. So next is William Chappis. I don't think he is here. He's a constituent of mine, so he may be stuck downstairs awaiting for a pass. We'll see. Mr. Nick Flynn. Welcome, Mr. Flynn.
Good morning.
The floor is yours.
I love to hear myself talk, so if it's okay with everyone, I'm going to go for the full 10 minutes. It's nice to see everyone here today. So good to see a great turnout. Good morning, Mr. Chair, members of the Law Amendments Committee, members of industry, and fellow vapors. My name is Nick Flynn. I'm 27 years old, and I co-own Halifax Cloud Company, a small chain of retail adult-only vape shops here in HRM. I'm here today to address Bill 233. Along with the previous amendments made to the Tobacco Access Act, I've been made aware that the taxation structure announced is kind of under a separate Financial Measures Act, so I'll look forward to seeing you all back here at Law Amendments when that goes through. I see Mr. McGuire still sitting in the on the committee. I told you a small part of my story back in 2015 at Bill 60's Law Amendments, and I wish I had an opportunity to show you my professional, personal growth under better circumstances, but here we are. I want to start by telling you all a little bit about myself, and that's going to be a good portion of my speech. How I came to be involved with the vaping industry and what brought me all the way to this point. I grew up in Bedeck, a small town in rural Cape Breton, and like many youth here in Nova Scotia, I spent my summers sailing in the Bredor Lakes, going for adventures in our beautiful forests, binge drinking in fields, and smoking cigarettes in the back seats of my friends' cars. Like many other youth, I was attracted to those things that my parents, my teachers, even law enforcement would have probably rathered me not be doing. This type of experimentation with taboos is a fairly natural behavior amongst youth, especially youth from rural areas, I think. And I'm sure many of you on the committee can kind of relate to a similar coming-of-age experience. I moved up from my parents' roof at 17 into an apartment in Sydney. You'll note that's still well below the age of majority. And I craved opportunities to flex my newfound freedom. Upon discovering that the needs around the corner from my home would happily sell me cigarettes, before long my apartment was filled with a blue haze of cigarette smoke. I told myself, I just like smoking, I can quit whenever I'd like, but as I think many in this room can attest, I was a bit off base with that assumption. Years passed, I grew older, but it seemed certainly no wiser, and I found myself smoking more and more. I joined the reserves for a time, and the social aspect of smoking became reinforced more than ever, but unfortunately, it's tough to pay the bills on parade nights and training weekends alone, and I spent many months hunting for full-time employment, the lack of options in Cape Breton taking its toll. Until one day, I sent an application to the local call center and received a call for an interview. I was thrilled, and without knowing what to expect, hopped on the bus and started work the same afternoon, but by the end of the week, I realized there was a caveat. The stress of working in such an environment, my already significant smoking habit had ballooned. It found new life, reaching nearly 2 packs a day and sometimes more. I was embarrassed. I smelled horrible. I tried to hide it from my parents, who humored me for my own sake, but certainly knew the score. I found myself spending an outrageous amount of money on cigarettes, often turning to bag cigarettes, as they're often known, to help stretch my paychecks. We'll touch again on that in a second. If I arrived at work with enough money in my pocket for a pack of cigarettes or lunch, my decision was already made: smokes every single time. Just a quick aside here regarding those bag cigarettes. So consider this a glimpse into what this bill will result in. The black market for vaping will inevitably eclipse the black market for tobacco in Nova Scotia. We already know how tough it is to keep illegal cigarettes off the street. You can't make cigarettes with products from a health food store in your pantry, but vaping products you can, and there's already a thriving black market for vaping products here in Canada. I tried to quit several times during this period. Eventually, I left the call center and was hopeful that a fresh start in a new job might help, but unfortunately, I was once again unsuccessful. I tried Nicorette gum and the patch, didn't do the trick. I even tried Champix, and after a week of suicidal ideations and nightmares, I gave up. Nothing worked no matter how hard I tried, until one fateful day I was strolling down Brooklyn Street in Sydney and saw a new sign I'd never seen before. Caper Vapor, I thought, what's that? Intrigued, I walked in and was greeted by a kind lady by the name of Joey who explained they sold electronic cigarettes designed as a less harmful alternative to tobacco cigarettes. She asked me about how much I smoked and for how long, what brand and type I smoked, what type of smoker I was, and what I thought it was that made smoking so irresistible to me. She walked me through the available devices, helped me select a piece of hardware that fit my needs, and then she smiled. "Here's the fun part," she said, and directed me toward a flavor menu with nicotine-free samples. I was floored. I came in skeptical, certainly not expecting to quit, and it was payday. I had 2 fresh packs in my pocket. There's no way this could work, I thought, but when she walked me through the 30 or so flavors available, ranging from black mirror to hot cinnamon, the wheels in my head began to spin. I tried a few, selected a melonberry flavor that seemed to suit my palate. She walked me through how the device worked and helped set it up, and sent me on my way. The rest, as the saying goes, is history. It was not an easy addict to break. Many folks speak of leaving a vape shop and never picking up another cigarette, but that was certainly not the case for me. Quitting anything takes work, and I had to make a very conscious effort not to smoke. But that 2 packs in my pocket lasted me almost 3 weeks. And after a month or 2, I found myself no longer craving a cigarette before bed or when I woke up in the morning. Vaping had effectively trained me out of cigarettes, and before long, many of my friends decided it was time for them too to quit. The running joke amongst my friend circle was that I was everyone's vape dad, troubleshooting their broken devices or passing along hand-me-down gear in a pinch. I was excited to see my friends finally find success in quitting smoking, and they were excited too. We were saving money, sure, but even more importantly, our taste buds were returning. Our lung capacity was improving, our blood pressure was dropping, and best of all, we no longer reeked of smoke. A job opened to manage the new Caper Vapor location in Glace Bay arose, and since this had become somewhat of a hobby for me at this point, I applied. The owner, Stephen, a Canadian Forces veteran who quit a 30-year-old smoking habit through vaping products, brought me in for an interview, and lo and behold, I got the job. I worked long days at the shop for months, traveling an hour and a half each way on the bus, but always had a smile on because I'd been given a very special opportunity. I was giving people the same gift that I had been given, and it filled me with pride knowing that I was helping those in my community. Mr. McClellan, you're fairly familiar with Glace Bay, and if the rest of you are, you'll know that its residents tend to face a lot of struggles with addiction. So it was incredibly rewarding for me to do my part in helping people in their addiction to tobacco, even if that was just one of the many issues they might have faced. Customers brought me Christmas presents, stopped by with coffee or lunch, and I forged meaningful, genuine relationships with many folks during my time there, all the while feeling truly privileged to be able to help them as I had been. I even dabbled in some political activism, pretending a petition with thousands of signatures at Bill 60 law amendments when this government first sought to ban flavored products. Common sense and good logic fortunately prevailed at the time, and we were ultimately successful, and since then, I can proudly say I've personally helped thousands of Nova Scotians rid their lives of tobacco. Over time, I moved to other shops, hanging my hat at locations around the province as I relocated, and eventually I settled into a job at Vapor Junkie, a local e-liquid manufacturer based in Dartmouth. John, the owner, who you'll hear from later today, also had a pair of retail shops called Vape Escape, and I worked as Vice President of Marketing for the Vapor Junkie locations and sort of an operations manager for the retail shops. We worked hard to provide the best quality products to our customers, and it felt great to be able to create these valuable products right here in Nova Scotia, rather than order them from Ontario or the US as I had seen in the past. After a year of tough but rewarding work, John presented myself and my soon-to-be business partner Andrew with an opportunity. We were given a chance to take on the vape shops as our own while he focused on his e-liquid business. I had some entrepreneurship experience in the past, and we forged ahead in earnest doing our best to make small improvements where we could, provide our customers with the highest quality products and a level of customer service we've been complimented on many times since. That was 2.5 years ago, and since then we have grown from a few guys busting our butts 7 days a week to a team of 8 employees, all of whom are truly passionate about these products and the positive effects they've had and will hopefully continue to have on Nova Scotians. Myself and Andrew recently went back to work full-time so we could reinvest our salaries to facilitate growth and pay employees better wages. We truly look at our employees like family. I cook us all Thanksgiving dinner every fall, host staff gatherings anytime there's a special occasion, and generally just do my best to treat them as I would have liked to be treated. They're a talented team of bright-minded folks, and I wouldn't trade them for the world, and I'm dreading the inevitable conversations I may have to have with them in the coming months as this legislation goes through unchecked. I feel there is a perception amongst lawmakers everywhere, not just in this room, that vape shops are all owned and operated by big tobacco, that we're all here for profits and nothing more. It's thought that we're the enemy. Well, I'd like to ask you all 2 questions.
Two minutes to your 10.
First, do you think Big Tobacco cooks both a turkey and a vegan roast for its employees on Thanksgiving? I do. Do you think they lay in bed at night wondering how they'll break it to their employees, that all their hard work has been for nothing, and that they may not have a job in the coming weeks? I certainly do. A third question, do I look like an ultra-corporate business person to any of you, fighting for tighter profit margins at every turn? I'll answer that for you. I don't think so. What about their customers? Do you think Big Tobacco wonders about elderly Maureen, who they lend a coil to once a week? I don't have the heart to ask her for the money, but we just want to keep her off her cigarettes. Well, that's what we do. I don't wish to evangelize myself here, so please don't get the wrong impression, but like many others in this room, I entered this industry and stuck with it not because it's lucrative, which in my case it isn't, but because it offers me an opportunity to help people every single day. Like any other harm reduction strategy, vaping isn't perfect. Everyone in this room agrees that youth uptake is a problem, and we'd be the first to say there are many opportunities for us to tackle the problem head on. But as I mentioned in my opening piece, youth are attracted to those things that they are told they shouldn't be. Even if you prohibit or tax them, they'll find ways to obtain them.
1 minute.
Many youth will simply have a friend of age who will walk into the nearest convenience store or gas station with no oversight or education. The person behind the counter will sell them a Juul or a Vite with the highest nicotine concentrations in the entire industry, just like it's a bag of chips. Other youth often order products online, often from China, where manufacturing standards on these products can be hit or miss. If you want to effectively curb youth uptake, we need to look at where, why, and how youth are obtaining these products. But it's important that we don't lose sight of the industry's reason d'etre, helping adult smokers find a less harmful alternative when, like myself, they just can't quit. Flavors are the single most important aspect of my journey to quit, and as I said previously, help me train my own brain to approach nicotine differently. They are self-incentivized and thus immeasurably more effective with pleasant flavors present, just like those available with conventional NRT products like Nicorette. While I agree that the best thing to do is quit, sometimes that's not an option, as any addict will tell you. The vaping industry has provided me with many gifts: personal and professional growth, lasting friendships and business relationships, and most importantly, freedom from the tyranny of tobacco cigarettes. And I have spent most of my 20s in one way or another helping folks see past the misinformation and fear-mongering to the truth that good science unequivocally supports. Vaping is less harmful than smoking, has the highest efficacy rates amongst NRTs available, and by its very nature saves lives of Canadians every day. The volume limits, flavor ban, taxation schedule, and frankly the large bulk of this bill will not reduce youth uptake, but it will kill small business in Nova Scotia, penalize adult customers and my employees, and put money in the pockets of Big Tobacco, who do not hurt from this bill. If this legislation goes through in its current state, you are effectively handing myself, my customers, my employees, and the rest of the nearly 60,000 vapors in Nova Scotia a death sentence. And the consensus amongst those I've spoken to is that it's a move primarily aimed at reclaiming lost tobacco tax revenues, since vaping has risen in popularity. I like to think the value of a human life is immeasurable, but many Nova Scotians feel that for this government, it may be measured in dollars and cents. Is that truly how you want to be viewed by your constituents, your peers in the world? Thank you.
Thank you very much, Mr. Flynn. We appreciate your story here today, and well delivered. Thank you very much. Just to go back on the three that we have missed here, Jody Howe. Has Jody Howe arrived? All right, thank you. And Stephen McKay. Okay, and then back to William Chappis. Please come forward, Will. So, Will, you just arrived. The order of proceedings here are a total of 10 minutes, 5 minutes for presentation, and 5 minutes for questions. And you, at your choice, may exceed the 5 minutes and just have less time for questions, and just wait to be acknowledged during question periods by the chair so that the mic can be turned on and Ledge TV can put the camera on you. So the floor is yours, Mr. Chappis.
Start with my name, William Chappis. I own a couple of shops in the Annapolis Valley. Fundy Vapors, growing up, former restaurant manager. To be clear, I have no affiliation with Big Tobacco. I do not buy any of my products, and I do not support Big Tobacco. I've watched several of my family suffer from Big Tobacco. Prior to today, obviously while we're all sitting here, youth uptake in vaping, serious problem. We recognize it. I saw it a year and a half ago when I walked into Scott Bryson's office when we watched it happen across the border. Not good. We need to educate, we need to show the families what this is about, what children are taking into their hands. We've got two different industries fighting over one product, and Big Tobacco is playing havoc with it. So I'm going to get right to the point. From what I see, the Liberal Party took direction from the Smoke-Free Act of Nova Scotia. 670 youth were surveyed on what they preferred and why they took this product. Almost all of them indicated that they chose 3 pods, paying $25 for these 3 pods. The majority indicated that they were choosing 50 milligrams of nicotine or more. The survey lets us know that's what they want. 51% also said that they prefer the head rush. When you're vaping 50-some milligrams, you're going to get high. So these are attractions that vape shops don't offer. It's not our products that were introduced on the market a year and a half ago. They weren't in our pockets. I went into Muddy's convenience store, a small store 200 meters from my community middle school. Wall-to-wall confectionery candies, 300 different types of penny candy. Stuffies, over here you've got chips, pop. When you get to the cash, there's a little metal box. And that little metal box is balloons, colorful, and it's got a question mark to just suck you right in there. And this is what's in this little box. 2 pods and a device. The receipt for this 2 pods and device is $12.65. So we're basing tax on this at $1.50. That's going to keep out of the hands of children? No, it's not. 3 of my kids go to school with lunch money. They all got a pod and they've got 58 milligrams in their hand. You walk into a vape shop in this province, this is an adult vape. $60 plus tax. You've got 3 milligrams of juice. There's $101. Which is the kid going to take? Let's be honest. We ID at the door. You don't get through our shops. You don't have attractions. Taxing this will cost my customer $30. I charge $28 for this. My objective when you walk in the door is to give you no higher than 20 milligrams unless you beg for it. And I'm going to get you down to 3, and then I'm going to get you down to 0. And then you're going to walk away from a vicious habit that's going to take your life. That's what we do. That's our job. This is Big Tobacco. They want you back. They want their customers back. They knew that they were going to lose. They created Saltnik. Saltnik contains benzoic acid. The uptake in nicotine rapidly is 2 times faster. There's the head rush. Take away Saltnik, we've got a problem with what we've introduced because now it's a preferred product. They've already gotten into our industry that deep.
You're at 4 minutes.
Thank you, sir. So in the study, they also indicate that the recommendations are to cap nicotine at 20 milligrams. So if we're looking at Smoke-Free Nova Scotia's study, we're not paying attention to what they're telling us. 20 milligram cap is reasonable. I think 24 possibly would be recommended. But if we look at the following, the British Columbia, Ontario, Alberta, and PEI, that's the direction they're taking. They aren't taking flavors away from adult vapors that prefer low nicotine, including myself, 0, but still do it when I have a beer or if I'm stressed out. Ontario, BC, Alberta, all those guys sat down with the industry, Canadian Vape Association. These guys know what they're doing. These guys have strategies on taking and tackling harm uptake, youth uptake and harm reduction. There's a balance there to save 17,000 Nova Scotians. Next year, 17,000 Nova Scotians will die of tobacco. We know that vaping is 95% less harmful. Health Canada on their website says, and I know a lot of you don't believe that vaping is less harmful. Health Canada tells us on the website, if you can't stop smoking, then start vaping. It shows temporary benefits. It has way less toxins and way less chemicals. For over 6 years, I've helped people in my community. Thousands of people have stopped cigarettes. They've started vaping. A lot of them have quit. ID everyone that comes through my store. I'm going to say right now, and I understand where the party's coming from, the CDC and the CBC And everyone else in North America ran with fear 2.5 months ago when people started getting ill from vaping. And of course, you're going to get the phone ringing. We've got people dying from vaping. This is scary. All of a sudden, you've got to form rules and regulations to get these out of the kids' hands, and you have to do it fast. But doing it fast, sometimes we don't see all the right avenues. We know now the CDC has retracted any statement that it was a nicotine product. We know it was vitamin E acetate that was in this product that made people ill. It is not water soluble. Let's not make rash decisions without all the information. Let's take time. We are not in a rush now. We don't have that product poisoning people. Reach out, work with the community, work with the industry that has this stuff in our product. We see stuff coming before you guys do. We are your sources. When my phone rang 2 weeks ago, university student from Acadia, do you have this product? I Google it. It's a disposable e-cigarette from China with 60 milligrams of nicotine. No lab testing. This is lab tested. We'd lab test this for diacetyl, which you're going to say, oh, I've heard of popcorn lung. You can't get popcorn lung from diacetyl, first of all. But if we're testing it to make sure it's not there, then we know we have a safe product. We also know that if Will buys this and your kid has it, you call this company and they're like, yeah, we sold this to Will September 1st. Will you look at the batch number? Then we can look at my camera and go, oh, Joey's mom came in and bought this because his mom has an 8-year-old that's smoking and she would like to see him have a safer alternative. I can't stop that. But we have control, we have accountability with our products. You're going to push this to the street, then we're going to have these scary issues that we're seeing in the United States that are about e-cigarettes because we got homemade stuff hitting the market. We have products that aren't lab tested. That's where we're going to run into trouble. I ask this government, this province, and everyone else to start working with an industry that's ready to work with you. We respect the government. We have tried and we've made huge strides to regulate ourselves, asking long before you guys asked us to. No one asked us to lab test juice. No one asked us to sell authentic products. You can buy knockoffs from China. Organic cotton, unnecessary. Most of the good products coming out now are surgical grade cotton. Cotton is what we use as a wick. Last thing I'm going to say is we have on our borders New Brunswick PEI. They aren't going the same direction we are at this point. They were keeping their flavors. They aren't going with a tax that's going to make this unattainable for my customer to drive them back to smoking, and that's what they're telling me. So for myself, as when I started my shop, there was 2 or 3 shops in the province I had to drive to get my stuff. I'm still going to drive to PEI or New Brunswick to get my stuff, or I'm going to get Joey on his trip or whoever to bring back my product. We're not going to keep the tax in the province. We're going to have underground products. It's an unfair business practice, what we're doing here. As a businessman, you're taking me completely out of the picture. That's obviously not your worry and not your intention. We want to stop teens from vaping, and we have an effective way to do it. Ban nicotine at 20, kill the buzz. No more buzz on nicotine. They can't get high off it. They don't want it. The phone rings. What's the strongest nicotine you got? And you just hang up the phone because you know the quivering voice is a teenager. I thank you all for listening to my spiel, as you may call it. I respect this government.
Thank you very much. We do have time for one quick question.
Yeah, thank you very much.
Mr. John, sorry.
Thank you, Mr. Chair. You brought a couple of sample devices with you today, and you were talking about the store that you went into, which I see myself, convenience stores with the pop, the chips, the candies, and at the front of the store, there's a little white box with the balloons all over it. There's actually the Esso in Fairview does exactly the same thing, right? So how many corner stores sell products similar to what you sell in your shop? So I want to clarify. So my understanding is that most corner stores, those devices would be closed pod, high nicotine devices like Stealth, Juuls, Vipes, or right. How many of the stores actually sell where you can buy a battery separately and a tank separately in different volumes and types and nicotine contents of juices? And do I only get that in a specialty store, or?
Mr. Chappis.
Your specialty stores cater to products that are individual to us. So the companies I deal with won't deal with big tobacco companies. We distance ourselves, the manufacturers as well as myself. So you'll see in the group I'm trying to get you to work with, we all work together against big tobacco. And the big tobacco moved into convenience stores and gas stations by buying a portion of Altria. Juul bought Altria, they joined together, so Altria is Marlboro. So Marlboro had the rights to go into every gas station, every convenience store. It was a business move, not about money, about access. So once Altria had a share in Juul, they could move in. Then you've got Vipe that moved in with their products, and they fought to get into the vape world. They come to our doors and they hound us to sell their products, literally. And you are absolutely right, sir. They do not carry any of our products. They don't carry low nicotine. Their objection is not to get you off nicotine, it's to keep you on nicotine. Thank you for your question.
Thank you very much, Mr. Chappis.
Thank you all.
Caitlin Hines.
Aaron's going to take my place, so I'll ask her to time for you.
Okay, thank you. Okay. You're okay for all the time?
Yeah. Is it okay to run it up from
Sure. Yeah, that's fine. Good morning, Ms. Hines. I think you've been here to understand the timing of things, so the floor is yours.
I am over my 5 minutes, and I apologize, but I'm happy to leave my contact information for anybody who has questions. I'd be more than thrilled to discuss any of the statements I make. My name is Caitlin Hines. I'm the operations manager for Halifax Cloud Company, a small business co-owned by my partner, Nick Flynn, who you just heard from. However, today I'm not here for myself, my partner, or even the business. I'm here for reason, I'm here for logic, and I'm here for science. I'm here for those who can't be. Before I started working with my partner, I was Executive Director and Science Communication Officer for a long-standing science education and advocacy organization. My degree is in science communication. I'm an expert in debunking junk science, identifying bias, and explaining difficult concepts to public audiences. I just never expected harm reduction to be one of those difficult concepts. And to quickly address a question from earlier, of course, we want to eliminate all harm. But that's an unattainable goal, so we can reduce it where we can. I won't bombard you with facts. There's only two I'll mention, because the Canadian Vaping Association has them in spades and have been pounding on the government's doors for months, desperate to be allowed the privilege of presenting them. No one in this room wants youth vaping, except maybe if there is a Juul rep here. I know they, a big tobacco subsidiary, were the only industry consultation taken by the government and the only company not hurt by the proposed legislation and tax. People who walk into our shop get ID'd as soon as they come through the door. The NSLC doesn't check until you're ready at the counter. Plenty of time for youth to browse the vast variety of flavored alcohols available. But I digress. Alcohol is a separate issue. No one in this room believes vaping is 100% safe. Putting anything in your lungs besides fresh air isn't going to be good for you. However, for many Nova Scotia residents, this simply isn't an option. Nicotine is notoriously one of the hardest substances to break an addiction to, and unless you've experienced it, you can never really understand. That's because smoking is more than just an addiction. It's a series of habits. There's the psychological habits of smoke after waking up, after meal, before bed. There's the hand-to-mouth reward conditioning from your limbic system, not to mention all the social aspects. Even if you forget the nicotine addiction, imagine trying to break multiple habits you've had for a lifetime, all at the same time. It's these habits that often cause people's willpower to falter, sometimes more so than the nicotine craving. And vaping helps mitigate these factors and is incentivized by flavors. If you have a sweet tooth, is replacing cookies with a rice cake really going to do the trick? For an addict, the choice between what will become a $60+ bottle of flavorless e-liquid, nothing, or a $20 pack of cigarettes is an easy one, and I think you know which option it is. While vaping may not be harmless, it is less harmful, and I'd like to come back to the two facts I alluded to earlier. 1, 100% of the vaping-related illnesses, as Will mentioned from last fall, were caused by illicit THC cartridges containing vitamin E acetate, as recently confirmed by the CDC. I understand that due to unjust media hysteria, this government was under immense pressure to take action, and a flavor ban was the quickest and easiest route available. But the news cycle has moved on. It's time to look at real solutions. An alternative quick fix could have been raising the age to 21, which makes sense from a youth brain development and social access standpoint for vaping, alcohol, and cannabis, which also comes in flavored vaping form and seems to be missing from this legislation. But I digress. Cannabis is a separate issue. The second fact is that vaping is 95% less harmful than smoking. The statistic is thrown around a lot, but where does it come from and what does it mean? A lot of advocates actually get this one wrong. The 95% comes from comprehensive independent reviews of scientific evidence by both Public Health England, the equivalent of Health Canada, and the Tobacco Advisory Committee of the UK Royal College of Physicians, one of the most respected group of healthcare professionals in the world. In science, a literature review, such as the one I'm speaking about, takes data from, in this case, well over 200 individual studies in a similar subject area and uses them to identify patterns and make generalized conclusions and recommendations about said subject. I'd be happy to walk anyone through the initial 113-page report and subsequent updates. But for now, I heard a great analogy during the second reading of this bill that I'd like to paraphrase and reuse. If I have to be hit in the face, I'd rather be slapped than punched. Both are going to hurt, but one hurts much less. Nicotine in and of itself, while highly addictive, is relatively harmless to adults, and I stress to adults. It's a low-level stimulant on par with caffeine. What causes illnesses in smokers is the combustion. It's the additives, the preservatives, the tar. The vast majority of chemicals causing smoking-related disease are completely absent in vaping. Those that are present are in such low quantities they pose limited danger, as toxicity is determined by both concentration and length of exposure. It's the difference between standing in Chernobyl versus standing 50 kilometers away. You'll still get a little bit of radiation from 50 kilometers away, but it's much, much safer for you to be there for prolonged periods of time. Additionally, studies which have found higher levels of chemicals have been retracted. This is because during those studies, devices were improperly used, causing cotton wicking in the device to burn and give off smoke. Burning cotton, not vaping. The science is in, and vaping works. In the time I've been speaking, a Canadian has died from a preventable tobacco-related illness. This method of so-called prevention to keep youth off vaping will send people to the grave, or at the very least, put even more strain on our already crumbling and frankly abysmal healthcare system.
4 minutes remaining.
I made the decision to leave my career and work at Halifax Cloud Company because it allowed me the privilege of helping people in their journey to quit, and people have quit. I choose to work in a vape shop because I believe in these products and their effectiveness, because I get to experience on a day-to-day basis the pride people feel when they come into the shop and say they haven't picked up a cigarette since the first day they walked in, to have a visible, measurable, positive impact in the communities we're located in. So no, I'm not here fighting to keep a business operating or to keep my job. I'm here today pleading for education. I'm here today hoping for open minds. I'm here today begging for you to do nothing more than actually listen. I'm here today for the elderly with 50-plus year addictions who no longer need assisted breathing, for the people who are low income, the largest percentage of smokers, who often make the choice between cigarettes and food, something I had to watch my parents do as a youth. I'm here for the children of smokers. I'm here for the people thrilled to call themselves ex-smokers. I'm here for the people who have tried and tried and tried everything else and finally had success only for it to be taken away. The only thing vaping and cigarettes have in common is nicotine. Following the logic in Bill 233, apples and eggplants, which also contain nicotine, could be classified as a tobacco product. Furthermore, most of the nicotine found in vaping products is the same pharmaceutical grade as found in other nicotine replacement therapies, which are not classified as tobacco. This time, I don't digress. Tobacco is a separate issue, and that's the point. Right now, Nova Scotia has an amazing opportunity to have the most protective and progressive vaping laws in the country, to be a world leader in harm reduction. Please do everything you can to protect our youth, but protect our adults too. Please exempt adult-only retail locations from Bill 233, Smoke-Free Places Act, and the Tobacco Access Act. Unless you do, you lose the adult-only access channels And you lose not only the care and education they provide, but you lose the tax dollars you're counting on as well. Work with industry and the CVA, as every other province in this country has, to help create a bill and regulations separate from tobacco that encompass the full scope of the vaping industry. Because if this bill has made anything clear, it's that the government just does not know enough to make effective decisions about these products. Because we do want regulations. We want permits and licensing and mandatory ID scanners at the door. We want a nicotine cap. We want reasonable and logical taxation. We want youth to stop, or even better, never start vaping. We want big tobacco to bleed. In conclusion, if you care about the health and well-being of all Nova Scotia residents, please stop handing them a pack of smokes.
Thank you very much, Ms. Hines. Ms. Roberts? We have a minute, so.
Thank you. Just to be clear, would you welcome the sort of legislative approach that has been taken in, can you name a jurisdiction? I've heard reference to PEI, to BC, to New Brunswick.
Ms. Hines.
Oh, sorry. Absolutely. BC and PEI are moving in the right direction. They have been long since in talks with the Canadian Vaping Association, and they are moving towards the adult-only access locations, removing high concentrations from all shops, not just gas stations, convenience stores. And as a side note, our shop, we do carry stealth devices. We do not carry Juul. And anything above a 35 milligram is under a counter and away from view, and it has to be specifically requested.
Thank you very much, Ms. Hines. We really appreciate it. It was a very clear and concise presentation. Thank you. Kelly Cole. You can certainly circulate your document. No pages. Good morning, Ms. Cole. The floor is yours.
Thank you very much. Members of the law amendments.
Excuse me, just one moment. Unfortunately, there's no pictures unless you're accredited media. So I have to
She's mine.
I have to ask you to delete your photograph. Thank you. Sorry to interrupt, Ms. Cole.
That's fine.
The floor is yours.
Thank you. Members of the Law Amendments Committee, thank you very much for the opportunity to speak to you today. My name is Kelly Cull. I'm the Director of Public Policy with the Canadian Cancer Society. We strongly support Bill 233, and we urge all members of the committee to support it as well. I'd like to applaud all of you for efforts undertaken in recent months to curb rates of youth vaping. I know many of you were present in October of last year when the Canadian Cancer Society hosted an MLA engagement event where many of you heard firsthand from Nova Scotia high school students about the impact of youth vaping in their schools and in their communities. CCS also spoke at the Standing Committee on Health about our position on e-cigarette regulation, and we are pleased that many of the recommendations that we, as well as a number of our health partners, who you'll hear from today, are being put forward and being discussed here today. You've heeded the warning. All parties around the table here today have articulated concern and put forward proposed solutions to address the issue of youth vaping, and to that end, we commend you all. In addition to Bill 233, government has introduced many important measures that will move us towards our common and shared goal of reducing youth vaping, including flavor restrictions, taxation models, enhanced licensing, and enforcement structures. I'd just like to acknowledge, alongside the government, PC leader Tim Houston for a private member's bill to remove flavors in e-cigarettes, and also commend former NDP Tammy Martin for her bill to restrict sales of vaping products to adult-only specialty stores. Bill 233 contains many important measures supported by CCS. Capping nicotine levels in e-cigarettes is tremendously important. CCS supports a nicotine cap of 20 milligrams per milliliter, a measure that would make e-cigarettes significantly less addictive and appealing to youth. This measure would mirror the regulations that are currently in place in the 28-country European Union, which imposes that same cap of 20 milligrams per milliliter. In Canada, British Columbia is implementing a nicotine cap of 20 milligrams per milliliter as well. The legislation being discussed here today supports measures to reduce youth access while also maintaining a market for adult users. As government continues to adopt measures, we would urge Nova Scotia to continue to look at additional measures. I know a number of people here today have mentioned PEI. As of March 1st, regulations came into effect in that province, which raised the minimum age for tobacco and e-cigarette products to 21, and also restricts the sale of e-cigarettes to adult-only specialty stores. CCS was very involved in working alongside the private member and the government on this particular bill, and we feel that it's a very effective way to balance public interest and also protect youth from health harms. CCS today would like to submit an amendment to Bill 233 for consideration. This proposed amendment is to place a ban on the internet sales for vaping and tobacco products in Nova Scotia. CCS advocates that this is an important measure that is crucial to the integrity and enforcement of regulations that will ban flavored products and also cap nicotine levels. The province of Quebec has legislation in place since 2015 which requires that the sale of all tobacco and vaping products be sold in a face-to-face exchange in a physical store, effectively removing internet sales in that province. The wording of the proposed amendment that's before you right now is based on the wording in the Quebec legislation. The Quebec model demonstrates that this amendment has precedent and has made an important difference in another Canadian jurisdiction. I expect that questions will arise relating to enforcement. In the Quebec experience, major retailers, Juul and Stealth, do comply with the law. An additional layer of compliance is enforced through carriers like Canada Post. I thank you for your consideration of this amendment and for the important work that's been done to date to reduce youth vaping rates.
Thank you very much, Ms. Cull. Mr. McGuire.
I got caught taking some breath mints, sorry. Thank you for being here today. I have two quick questions. One is there any proof that nicotine causes cancer? And secondly, why is the Canadian Cancer Society involved in a vaping bill?
Ms. Cull.
So, many of the health harms that are associated with vaping are unknown because this product is so relatively new. There's a better understanding at this point of some of the acute pulmonary impacts, as an example of vaping. I think those are, a lot of the things that we've been hearing about recently. Some of the long-term health impacts with diseases, cancer would be a really good example of that, will not be known for many, many years, probably 10 to 20 years. The Canadian Cancer Society just released a research grant that is funding some research being done to better understand some of the longer-term health harms of vaping products, but we won't know for some time, and really nobody will. We are urging governments to operate on a bit of a precautionary principle. There is going to be a health impact of vaping. I think that we all know and understand that. What that looks like and what it is probably is going to be yet to be determined. But we waited so long to really understand and fully cross the T's and dot the I's on what the health impacts of tobacco are. And so I think that we can all probably collectively agree that we don't want to be in that same position in 10 or 20 years when it comes to e-cigarettes. And with respect to the Canadian Cancer Society's involvement, one of the core pieces is around what I've just talked about, is the potential for a longer-term cancer impact related to smoking, related to vaping. But the other piece is that we also know that young people who use e-cigarettes are more likely to become smokers of tobacco as well, and that's a concern, obviously, from a cancer perspective.
Ms. Roberts.
Thank you. Are you, in the absence of passing this amendment, are you confident that Bill 233 would actually have the impact that you and other health advocates are pushing for? And I'm going to beg the indulgence to ask a second question, which is, are you hearing anything today from the independent vape shops that is giving you pause about the approach that we've seen from the government?
Ms. Cull.
So with respect to the bill that we're talking, to Bill 233, we certainly supported a cap on nicotine levels is very, very important. We've seen that being done in the European Union, and yeah, I think it's definitely an important part of the regulatory framework, alongside with the other measures that have been introduced by government around taxation, around banning flavors, or restricting flavors, I should say. This is the way that countries and provinces are going. We know that even in the PEI experience, they're consulting on regulations around flavors. We know that in the U.S. experience, there are many, many states that have undertaken flavor bans. Massachusetts, Rhode Island, New Jersey, their flavor ban will come into effect on April 1st. There is widespread recognition that flavors, I know you'll hear from my colleague at Smoke Free Nova Scotia later on talking about the appeal of flavors with respect to young people, and so that is an important component of the regulatory approach here.
Ms. LeBlanc.
Yeah, I mean, I was kind of going to ask the same question, but earlier in your remarks, you said that this bill will also maintain a market for adult users, and what I've heard from all of the vape shop owners, representatives that have been here today, is that that's not true. My big concern is their argument about pushing things to the black market and then having no control over that. And I'm wondering if you've sort of I was on the health committee, so I heard your excellent presentation there, but even in preparing to present to the health committee, is that something that was thought about, considered? How do you think that this bill protects against that, or does it need to be strengthened to protect against that? Thoughts?
Ms. Cole.
Certainly it will. I mean, that's definitely a thing that needs to be considered by the government. There's going to be an impact in terms of regulation, in terms of enforcement, and I think the government is going to need to look at resources and ensure that the market is being well controlled and that the market is being well monitored.
We have a little over a minute. Any other questions? Ms. Roberts?
Given the argument that we've heard from vape shop owners, when you and I first met and talked about this issue, which was now more than 6 months ago, you definitely talked about needing to restrict it to 21 and up. And restrict it to adult-only vape shops. The adult-only vape shops are saying that other provisions in this legislation, plus in combination with the taxation per milliliter, are actually going to put them out of business. Could we have effective regulation based on lower nicotine levels, adult-only vape shops, while lessening some of the other provisions in this bill and the taxation measures, or making the taxation measures be per milligram of nicotine instead of per milliliter of liquid, and actually end up with more effective regulation?
Ms. Cole.
A lot of the success that we've seen in tobacco control areas is in this comprehensive approach. So we know that there is no one turnkey solution here with respect to youth vaping, and so we need a good cross section of legislation that is going to support, one piece supports the other if we're going to be effective in terms of our long-term goal of reducing youth vaping. I think probably the question that you're getting at really is specific around flavors. Like I said, you're going to hear from Smoke Free Nova Scotia later on about the work that they have done in this market that really speaks to the fact that flavors are a driving force in terms of young people using these products. And so this is an important part of this legislation alongside other measures. We've talked about sales restrictions into convenience stores. We've talked at length about age 21 being an effective, important measure. But really the strength in this approach really is in that cross section and is really in the comprehensive type of policies.
Thank you very much, Ms. Cole. Thank you for coming in today. Next, Elias Bitar. Mr. Bitar, did I pronounce your name correctly? Great. And you've got the timing down, up to 10 minutes?
Yep.
5 and 5, how you so wish. The floor is yours.
Thank you. So myself, I am 29 years old. I've been vaping since I was about 24. Smoked from very, very occasionally from age 16. Progressed more as I became of age because the availability, because of being able to just pretty much get it anywhere. Relative of mine in 2014 opened up a vape shop. I started with 3 milligram, instantly quit smoking. Didn't buy maybe one cigarette a year after, or buy one pack of cigarettes a year after. I was in the industry, I worked in the industry, I opened up my own shop, 2018, it was two years ago last week. We've built the business, we've helped probably over 1,000 people. I employ 1 full-time employee, 2 part-time employees. I support my family with this business, and I've never been better off. I have clients who are so happy to support us. I know you guys have received calls from my clients because I've watched them call your office in front of me. They're all very worried. They're asking me to stock up. They're asking me to do anything possible to keep the flavors for them. And I can't guarantee any of that. I feel like a very small fish in a big pond. Personally, the big tobacco argument, everyone said it. The 21, everyone said it. Just we ask, you can do all of that. You can raise the age, you can limit the nicotine, limit online sales. Flavors are a big part for adult users. I didn't start on a tobacco. I never enjoyed tobaccos. I don't plan on vaping tobaccos after the ban. Like we said, it's very easy to get it online now. I currently do sell through my website, and if I didn't ask for proof of identification, it would be easy for anyone to order it online. And I've ordered from other sites that don't ask for proof of identification. So I know how easy it is. I mean, we do our absolute best. It's very apparent when someone is buying for someone else, and you have to explain to them that, this is not something we condone, but at the end of the day, you have no legal right to refuse service. There's no penalties. The penalties, are just not strong enough for those people. If someone earlier mentioned about fines for selling to minors in the liquor store versus in a convenience store, I would support an increase to the fine because $1,800, in my opinion, is not enough. But as a comprehensive measure, all of those things combined would have a huge impact, and it wouldn't impede my option for a smoking cessation device, and it wouldn't impede my customers' options for a smoking cessation device. But the main concern that I think you should be considering is the black market, and that's one that I could see when I was 13. Anyone I knew could buy marijuana at 13 years old. Drug dealers don't ask for ID. Margins for e-liquid are good enough to incentivize them to sell it, and margins are better if you make it yourself. If you make it yourself and you don't know what you're doing, like what happened in the United States. We had, I think, 2 cases in all of Canada that they haven't linked to the vitamin E acetate. Possible that it was vitamin E acetate, but it hasn't been proven. There's a big difference because here our market, our government decided that marijuana was black market for so long, and they took over that market, and that saved our citizens. It's helped them. It stopped that spread from coming from the States to here. In those states where they're affected the most, they have the black market for marijuana devices, and I don't think that our citizens need that exposure, especially if you're worried about kids, because kids will buy it on the street if they can't get it online or anything like that. But at least if they do get it somehow, it will be regulated in some way. It'll be less harmful to those children. As a father of 2, I can appreciate your concern for younger people, and none of the people here would condone anyone under 19 using the product. But I understand that you guys asked earlier for more question time, so I'd be happy to answer any questions.
Great, thank you, Mr. Bitar. Ms. Roberts.
Thank you. A number of the vape shop owners have talked about stealth and the fact that stealth is not owned by Big Tobacco and therefore it's sold in the shops, but it's still a pre-filled pod, and the impression I'm getting is that pre-filled pods are are the devices that are attractive for young people as well as high nicotine. So why do you choose to sell it?
Mr. Bitter.
Sell stealth, and that is kind of our way of following the market without having to support Big Tobacco. So one of the speakers earlier today alluded to that they did a trade-in program where if you brought your Juul, they would give you a stealth for free, right? So that is their concession to their customers. It's like, hey, I know you want XYZ product, but I'll do something for you so you don't have to use XYZ product, but it's a similar product. It's a Canadian company, so we feel better supporting it. But really, it's capitalism. We have to offer something, and if you don't, you go out of business, right? So that.
Ms. Roberts.
May I? And so, explain to me the profile of the consumer who is choosing to use the stealth product as opposed to the other devices that you have.
Ms. Bitter.
So I have a wide variety of customers that use those, but for young people, it's easier because it's smaller. It's easier to hide. They call it ghosting. When you vape it, you hold it in long enough. When you exhale, nothing comes out. So yeah, that product makes it easier to hide. But I have older clients who just want something easy. I wouldn't be opposed to dropping pod systems altogether if that meant that you could keep flavors. I think that would be a good concession, and that would be, in my opinion, it would be acceptable. Not encouraged, but acceptable, because I think it was Ava said earlier that people who are 50 years old, they're not tinkering, they're not doing any of that. If they need either specialized help, which is what a vape shop can offer, or they need something easy. And unfortunately, the something easy is only available in higher milligram and is what is more attractive to anyone who's trying to conceal it or hide it from their parents, which is teenagers.
Ms. LeBlanc.
Thank you. Excuse me. A number of the vape shop owners today have referred to the science and that the science is safe. And then we've heard from someone from the Canadian Cancer Society to say that we don't really know what, in terms of cancer at least, we don't know what the effects will be for 10 to 20 years, or I guess 20 years down the road. So when I hear the science is safe, I'm wondering what's the science? Like, what are the reports? Who's done them? I've heard reference to Health Canada. Can you talk a little bit about that?
Mr. Bitter.
The big studies from the I forget exactly. It's the Royal College. It's in the UK. They came out 2015, something like that. It was the number that came up was 95%. It's 115 page or 115 page report. But they were also the same organization that came out in the 60s and said the cigarettes were bad for you. No one listened to them then, and a lot of lawmakers aren't listening to them now, but it's the opposite effect, right? I mean, yes, a lot of the studies say that it is 95, some said 97% safer, but I'm not a doctor, so I couldn't tell you, and I tell my customers that too. They ask me, is it safer? I'm like, listen, you could do your own research. Personally, I feel great. I didn't smoke for long, so I didn't have much of an issue to start with, but I feel good. It's been about 5 to 6 years. But again, I think that the government, if they wanted to fund more research, would be fantastic. But I don't see the involvement from Health Canada. Like, they've decided to restrict what can be on the label and that kind of thing, as opposed to really diving into the health benefits. Places like the UK, they have legislation now that they're pushing to offer it as a prescription and have your health insurance cover it to get you off of cigarettes, because they see that they're saving money in their healthcare system getting people off cigarettes. So that would be, in my opinion, that would be really beneficial for Nova Scotia, especially because other people have alluded our healthcare system. I know I'm 29 years old. I haven't had a family doctor for about 6 years. I kind of piggyback on my kids' appointments. That's how it's been for me for the last year, almost 2 years.
Mr. Johns, just a quick one. Would you have a quick one?
Yes, thank you. So can you really quickly tell me, one of the previous speakers had mentioned that she keeps a database and her clientele is all digitalized and computer and everything, and they keep track of age verification that way as well. Do you do similar type of system in the store?
Mr. Bitar.
I just check ID every time, you know, unless it's someone obviously that I've recognized several times. We check ID, but I know other people alluded to ID scanners. I would be very, very into doing that. You know, it's a small expense to have that product in your store, and it doesn't have to be at the door. It can be at the counter, but at least you can verify it's a real identification. So we have refused people based on skepticism, but we don't know for sure if it's fake or real. But you know, a $2,000 purchase, $3,000 purchase to get one of those would be great. If that's like I said, there's so many things we can do other than get rid of flavored e-liquids that I think would make a huge impact.
Great. Thank you very much, Mr. Bitar. Appreciate you coming in. We'll now move on to Shauna Walker-Young. Thank you for coming in, Ms. Young. I don't have a hyphen here. Do you want me to refer to you as Walker Young or Young?
My whole life I've been Walker, so we can stay with Walker.
Go Walker? All right.
Okay, I apologize.
No problem. You're settled in?
Yes.
Just, if you want to take a moment and grab a glass of water, you're welcome to do that.
Do I look that harried?
Take your time. It's okay.
Okay. Excuse me.
So the floor is yours.
Okay. Good morning, and thank you for the opportunity to be heard today. My name is Shauna Walker-Young. I was born and raised in Nova Scotia. I am a 47-year-old wife and a mother to two boys, 12 and 13. I was introduced to vaping in 2005. With my brother's second cancer diagnoses, I started my research into safer alternatives to smoking. At that time, all e-liquids were manufactured in China. My research stopped there. In 2014, I quit my job of 12 years to open the first vapor trail in Lower Sackville. People thought I was crazy, but I believed in the technology and I knew vaping would save lives. Over the next 5 years, we grew to 14 locations, servicing customers across Atlantic Canada. Adult customers only. I have met thousands of people, heard their stories, and shared in their successes. They have always been so grateful and appreciative of the support and guidance we give. We are providing them with a new alternative, and they are succeeding, finally able to break free from their deadly addiction to cigarettes. One story sticks with me. A 96-year-old woman brought her 78-year-old son in. They were coming from the doctor. This mother purchased for her son a new vape setup. We set him up, educated him on the product and how to use it, and he left the store vaping. Many of our customers are elderly. Unfortunately, most are living off fixed incomes, something to consider when reviewing the new taxation guidelines. With the nicotine, this pod has 60 milligrams of nicotine. The tax would be $1. So $1, $2, $3. 60 milligrams. 3 milligrams would be $30 tax added to the original price. 60 mil would be I'm sorry, that would be $15 tax added, $30 tax on a 6 milligram. 0 milligram, which many customers do smoke, that would be $60 in taxes added to a 0 milligram vape product. The push to resurrect Bill 233 for amendments began with deaths in the U.S. from black market THC vape products. This outbreak was linked to vaping nicotine e-liquid. After investigations, it was revealed none of the cases were related to vaping professionally manufactured e-liquid. Despite what you do here, people will use flavors. Black market production of e-liquid has long been an issue. We call them bathtub brewers. These mixers literally mix their juice in bathtubs. They bottle it in their kitchen and they sell online for cheap. This will all be unregulated, unsafe, and untaxed. The flavor options have been essential to getting our customers away from combusting tobacco. The decision to ban adults from getting non-tobacco flavored e-liquids on April 1st will kill the independent, adults-only vape shops. This is where big tobacco will take over. Just like cigarettes, their products will be in every convenience store, on every corner, easily accessible by youth, sold by youth.
You're at 4 minutes.
The reason employees of specialty vape shops are so highly trained is because this is all we can sell. We can only sell items directly related to the use of an e-cigarette. We can't even sell an accessory like a carry case. So very limited options for making money there. 90%, over 90% of our sales are in flavored e-liquids. With 14 locations, we employ approximately 60 full and part-time employees. Already, we have begun taking steps to close some of our locations. With other provinces across Canada targeting the real cause of youth vaping surge and dealt with it by limiting convenience store sales, limited nicotine levels, and most importantly, designating adult-only vape shops with the role of educating and selling vaping products to ex-smokers or those who want to quit it. BC, Alberta, Saskatchewan, Ontario, and PEI got it right. I am respectfully asking you to press pause. Work with us to come up with practical and effective solutions that will ensure youth don't get vape products. Adult smokers have a safe and proven vaping path to quit smoking, and new taxation is fair and funds public education and enforcement. Please put a pin in Bill 233 and establish an all-party committee to address any vaping concerns you have in a thoughtful and educated manner. Lives are counting on it. I've brought here our training manuals for all of our employees. We have one for, I didn't bring copies for you. I didn't think you wanted to sign non-disclosure. So this is our employee training handbook, and it goes through everything from our policies and ideals and to how to teach people to use vaping products and the research that's in the vaping industry. Battery life and coils, and this is what our employees get when they come to us. They need to learn. They're told that is going to be their main focus when they start with us.
We're at 7 minutes, just to let you know.
Okay. Thank you very much.
Thank you. We do have 3 folks with questions. Mr. McGuire.
Thank you for being here today. So obviously you're one of the larger vape organizations here in Nova Scotia. You answered part of my question, which was what training do they get? But the second part of that is who designed those training? You have over 60 employees. What health organization or what scientific organization helped you create those training programs? Because, as I stated to earlier organizations, this nicotine is still a drug. And so you have young people as young as 19 or 20 working in your shops, I assume?
Ms. Walker.
Maybe, sorry.
It's okay.
So what kind of background do they have to be able to essentially prescribe nicotine to somebody who comes in?
Ms. Walker.
We start employees. I created this handbook. The information is taken from several different sources, and it's all just facts collected and how we would like it to be sold. I did notice someone mentioned that there's no way of telling if someone is going to sell to an underage and that you can't refuse. We do refuse. If someone comes in and says, I think my son said it was a 0.3 or they wanted 3 milligram, we refuse to sell to that person. They're not happy. But we feel very strongly about adults only in our store having access to our products.
Thank you. Mr. Johns.
Just to follow up on the previous question, so there is not currently a standardized testing or training that the industry, people in the industry, owners of shops and anything else have to go through. Similarly, or on the other side, I guess, if there's bartender training and there's training that's offered through the restaurant associations and that people have to take before they can work in those industries as a bar server or anything like that. So if the same type of training was offered to people who owned vape shops, you'd be agreeable to taking that and have your employees taking that?
Ms. Walker.
Sorry. Yes.
Okay, thank you. And
Mr. Johns, okay, we're out of time here, so I'd like to thank Ms. Walker for coming in today.
I've taken an excerpt from our training manual on how we train our employees to deal with customers when they come in, and I'd like to.
Yes, that'd be great. Thank you. That'd be helpful.
Thank you.
We've had a lot of questions on training, so that'd be very helpful. Thank you.
Thank you.
Dr. Gary Ernest, President of Doctors Nova Scotia. Welcome, Dr. We'll have the page distribute that for you. I know you just arrived, Dr. Ernest. The format here is a total of 10 minutes, 5 minutes for presentation, 5 minutes for questions. But if you want to exceed the 5 minutes in your presentation, that's your choice. It'll just be less time for questions. So welcome, Dr. Ernest. The floor is yours.
Thank you, Mr. Chair. Good morning, Mr. Chair. Good morning, members of the Law Amendments Committee. My name is Gary Ernest. I'm here as president of Doctors Nova Scotia. I'm a rural family physician. I've been in practice on the southwest coast of Nova Scotia for 37 plus years. We at Doctors Nova Scotia first would like to take the opportunity to express our support for this bill in which Minister Delory has proposed amendments to the Smoke-Free Places Act and the Tobacco Access Act. We'd also like to strongly applaud the government for taking the steps that it is taking at the present time to limit the nicotine content of tobacco and to limit access to nicotine-containing products and other potentially harmful products to Nova Scotians of all ages, but especially youth. And as part of that, we also would like to applaud the work that's already been done in terms of banning the sale of flavored e-cigarettes and flavored juices that will come into effect this spring. I'm a family doc. Some people will call me old. I prefer to call it seasoned. I have a comprehensive, busy family, typical rural family practice in Liverpool. And over the years, as part of my practice in the office, in the emergency department, nursing homes, doing house calls, looking after sick people in hospital, I've seen the ravages of smoking. I've seen the multiplicity of diseases it can cause, anywhere from an innumerable types of cancer to heart disease, lung disease, and the list goes on and on. The government really is to be commended in taking steps with regard to its desire to protect Nova Scotians, which it has to do, because the effects of smoking are so well known and they're so horrific that any effort that the government can take in order to protect the citizens of this province is so critical, and even more so, protect the younger people who at a very young age are more impressionable and they may be more likely to dive into using nicotine-containing products. And if we can limit access to that and limit the amount of nicotine in these products so that they're not, if they do participate in this, it's less harmful to them, then that will certainly have important positive spin-off effects. The tobacco industry is always going to come up with ways, they will try to come up with ways to do end runs, if you will, around any sorts of regulations that come up to try and limit access. As we've all seen with the advent of vaping, flavored juices, tobacco chews, et cetera, when a block is put in place, they're going to try and find a way to get around it. Moving forward, it's absolutely critical that the government continue the work that it started by proposing these amendments to try and protect the public in so much as limiting the nicotine content, I should say, of tobacco-containing products, of any type, limiting the nicotine content of other types of products, giving peace officers the opportunity to do their work in terms of being able to investigate and have vendors be required to help them investigate and to address the issues of people who are using this product or buying this product inappropriately. Plus, looking at even the exposure of the public sitting on patios where restaurants have found loopholes so that they make their parts of their patios non-smoke free. This sort of work is critical. It's essential for the future health of everyone in Nova Scotia. And, we, the physicians, the doctors in Nova Scotia, but we, the physicians of the province, really ask the government very strongly to proceed and to pass this bill. Thank you. I'm happy to take any questions.
Thank you very much, Dr. Ernest. Ms. LeBlanc.
Thanks for your presentation. One quick one maybe a little bit more complicated, but number one, do you think that vaping saves lives?
Dr. Ernest?
No. That's the short answer. The longer answer to that is vaping products often will have nicotine. The concentration of nicotine for some of the vaping products that are available is at least 3 times what they are in cigarettes. And now, with as we've all heard about some of the diseases that we've seen in the States and starting in Canada, there are many problems that we haven't yet identified with vaping, and we're seeing people, including young people, dying of lung disease and that has been attributed to vaping.
Mr. McGuire.
Thank you for being here today. Just one quick question, just a quick run through this manual, or the training manual that was given to us. There's a line in here, and I just want you to comment on this line. It says, to new employees, we are more like counselors than sales clerks. What's your thoughts on that?
Dr. Ernest?
May I ask who that training manual is for?
This training manual is from a vape shop that's given to all their new employees. So one of the lines in here to all new hirees is, we are more like counselors than sales clerks.
Dr. Ernest.
That line concerns me because an employee, vape shops are set up to sell vaping products, and I have concerns about vaping in general, so that line does not give me any comfort whatsoever.
Mr. Johns.
Thank you very much. Although the questions I ask may seem different, I think in some cases we're probably closer to the same goal of stopping youth vaping than what it may seem when I ask my questions. Nicotine, my understanding is addictive. Similar to alcohol, similar to hardcore drugs, similar to opiates. I know that there are alternatives now that are available through like methadone. There's methadone clinics here and around the city of Halifax which are trying to help people to be able to get off opiates. I don't think methadone is an ideal way to help to kick the opiate issues, but it's an alternative that's there. In regards to nicotine, we have certain alternatives that are existing, such as the patch and lozenges and medical prescribed drugs, as well as like Champex, and those all help. So I'm kind of confused why, there have been no deaths in Canada that have been related to vaping. I don't think popcorn lung has been discovered in Canada in regards to vaping. I know it has in the States, but I don't understand why, although the doctors, Nova Scotia, I'm assuming, supports methadone to get off of opiates, I'm not understanding why they wouldn't look at vaping as an alternative to nicotine. And I understand the concerns about the concentration in that. I think we're right on with that, right? And same with access and all that. I have those concerns. But I'm curious why Doctors Nova Scotia doesn't see vaping as a alternative, a viable alternative to tobacco, particularly given the chemicals that are found in tobacco.
Dr. Ernest.
These are early days yet for vaping. We're already starting to see problems in people who have vaped, even in people who have vaped with products that seem to be innocuous. The problem with products that seem to be innocuous is many times it can take years for the effects to show. We are very concerned about the potential for these effects showing up. We've already started to see some illnesses as a result of vaping, and we feel that it's in the future, as years go on, we will see more and more adverse effects from vaping, and that's the reason why we don't see it as a viable alternative as a method of stopping smoking.
Ms. LeBlanc.
Thank you, Mr. Chair. So I had one other question, but I think you've kind of just addressed it, so I'm going to ask you a different one. Somebody said earlier, and I think I got this true, one of the vape shop owners alluded to or made the assertion that with sort of typical smoking cessation products like the patch or Nicorettes or the inhaler and those kinds of things, that the lower end of the vape products have a similar amount of nicotine in them, and in some places they are now being used sort of in the same way that those other products are being used. Can you speak to that at all?
Dr. Ernest?
What we do know is that when many people start to vape, they continue to vape, as opposed to when they start to use Nicorette gum, when they start to use nicotine patches or the other products such as Champix, where when they start to use it, there's a definite end in sight. They're going to use it for X amount of period of time, then they will be off it. Vaping doesn't, that's not typically what we see with vaping. Very often what we see with vaping is people will continue to vape as a substitute.
Thank you. Thank you, Dr. Ernest, for coming in today.
Thank you very much.
Sherry Bain. Welcome, Sherry. I'm just not sure when you came in, so just to review that we have a total of 10 minutes. You can do 5 minutes or more for presentation, and the remaining 5 minutes or less for questions from my colleagues at the table. I'll try to as well give you a 1 minute warning on the 5. The floor is yours.
First off, I appreciate the opportunity to be heard on this issue. My name is Sherry Bain. I'm not a vape shop owner. I am simply a vapor trying to save my life. I was a smoker for 30 years, and I'm going to read this because there's things that are important to me to say, and I don't want to miss anything. I was a smoker for 30 years. I tried every quit smoking method available, some more than once. When I finally quit with vaping, I was up to a pack and a half a day. I lost all of my grandparents and my father to smoking-related illnesses. I'm simply trying to save my life. Recent studies estimate 1 in 5 deaths in Canada over the last decade are due to smoking. Healthcare costs attributed to smoking and smoking-related illnesses in Nova Scotia in 2012 were at $321 million. That was 8 years ago. It's many millions more now. But here's the good news, and bear with me, because if all you know about vaping is what you've learned in the media, I want to tell you that there's a lot more to know, and there's a lot more truth than what we've been given. Studies have shown that vaping is more successful than all other quit methods, including those prescribed by a doctor. 21% success rate in the most recent study compared to 6% success rate with the patch. Canada has been slow to do their own research on vaping, but Public Health England has been researching vaping for over a decade. It consistently maintains that vaping is 95% safer than cigarettes. Coincidentally, this is the same medical body that was one of the first to speak out about cigarettes being addictive 70 years ago. Countries like Britain, New Zealand, Scotland, and Australia have embraced vaping as a significant public health benefit on their road to becoming tobacco-free countries. The UK is putting vape shops in hospitals. Australia has banned smoking on their hospital properties and are offering patients free vapes. Here in Nova Scotia, our government is squandering what could be the biggest public health benefit in decades. Flavors are a significant element of the success in quitting smoking with vaping. That isn't my opinion. It's the consensus of 25,000 vapors from a flavor study conducted by a world-renowned vaping researcher named Konstantinos Farsalinos. The study goes on to say that fruit and dessert flavors are the most popular among adult vapors. That brings up the reason this government implemented a flavor ban, the belief that it was flavors that drew kids to vaping. According to the CDC's most recent research, out late last year, the #1 reason kids vape is curiosity. It's the same reason they drink, it's the same reason they try marijuana, it's the same reason they try sex. Flavors and doing tricks, and a quick Google search will show that to you, ended up 4th on that list.
4 minutes.
Okay. What you may not realize is the year that we saw a jump in youth vaping was the same year that Juul came to Canadian markets. Juul is a pod system, meaning a small battery with a space to add pods filled with e-liquid. Juul has 83% of the Canadian market. They are in corner stores and gas stations all over this province. Juul is the device of choice among teens. Juul is owned by a tobacco company and is currently being sued in the US for marketing to children. Let me repeat that. The vapes your kids use are made by a tobacco company. Research conducted by the University of Waterloo says that for all the kids that try vaping, only 1% vapes regularly. It's time for this government and many others to start making a distinction between youth vaping and youth trying.
5 minutes.
The volume tax being proposed is perfectly poised to support the big tobacco companies that make pod vapes. Big Tobacco sells high nicotine, low volume pods. Their patented formulations are exponentially more addictive. A 50-cent per mil increase ends up costing an extra 50 cents for that pod. 3 in a pack means an extra $1.50. I choose to smoke low volume nicotine. So this bottle that I buy at 6 milligrams compared to 60 milligrams costs me currently $33 taxes in. When your proposed tax goes through, this bottle will cost me $69. The same tax cripples the vapor that prefers not to vape higher nicotine. Flavor bans and ridiculously high volume taxes will force many people back to cigarettes. Anyone that cannot afford a $69 bottle of liquid will find a $15 pack of 20 cigarettes a lot easier to afford. None of the vapors I know want to vape tobacco. We're trying to quit tobacco. The countries I spoke of earlier do not have youth vaping problems, nor have they implemented any of the excessive measures being proposed, including a flavor ban. Your proposed regulations will shut down the only part of the industry that's really interested in seeing people quit their addiction to nicotine. Small mom and pop shops want to see you quit. Big tobacco doesn't. The signal you send by endorsing these regulations that only benefits big tobacco and shuts down small businesses says more about tax revenue than harm reduction. If this government and the health committee hadn't refused to meet every vapor that wanted to speak, we could have offered our input to help inform these policies. The research is out there. Nothing that I have said here today can't be supported by research. It's there. 1,700 Nova Scotian smokers die every year from smoking-related diseases. Another 200 die from secondhand smoke. Not one has died from vaping nicotine. Please help me save my life. That's it.
Thank you very much, Ms. Bain. Mr. Johns.
Thank you very much, Ms. Bain, and I will say that almost everything you just said is probably how I feel. I've done enough research, I vape, and I understand everything you just said, so I agree with you. The one thing that you've said that also came out that my intention is to try to move an amendment here today. Well, I don't think it can be done here today. I think it's actually in the Financial Measures Act where it lays out the cost of the tax on it. But I think one of the things I'm hearing that I think has a lot of merit is in regards to right now the tax is on the volume of liquid regardless of the concentration of nicotine, and I do think that there's merit in looking at having higher volumes of nicotine as well. So just for clarification, have you ever smoked or used Juul, Stealth, Pearl, or any of those ones that are sold with the closed pod systems? And if so, how do they make you feel in contrast to the machine you typically use?
Ms. Bain?
So I'll tell you why I have used those. I have a Stealth. The reason that I choose to use a Stealth is because smokers and vapors are not very well received in the community. So I do what I can. When I'm home, I use a bigger piece of equipment. When I'm out in community, I don't want the comments, so I want something that's discreet. I know that vape shop owners, I'm not a fan of the high nicotine, and I'm definitely not a fan of big tobacco. It hurts me that the regulations that you guys are planning will do nothing but support big tobacco, and they created the problem in the first place.
Thank you very much, Ms. Baines. Thank you for coming in and providing your perspective.
You're welcome.
Next, we have Mohammed Al-Hamdani. Welcome, Mr. Al-Hamdani. You've got the routine down on the 5 and 5, or do you need me to review that? 5 minutes for presentation, 5 minutes for question. You're good there? All right. Thank you very much. The floor is yours.
All right. Respected Chair and members of the Law Amendments Committee, I am thankful for the opportunity to speak about Bill 233. Smoke-Free Nova Scotia is a coalition of members with a shared vision of a smoke-free province. Throughout the years, the government of Nova Scotia has demonstrated bravery in doing what is right for Nova Scotians and their health, especially our loved and valued youth, who are the future of this province. Bill 233 is consistent with the Nova Scotian saga of public health and policy leadership. We commend the government for proposing this bill in addition to the taxation changes that were formally announced with the budget for 2020 to 2021. I will comment on the importance of the policy levers within Bill 233 to substantiate moving forward with them. But before I do that, it is imperative to understand why the bill is warranted at a high level. And there are 3 things to note here. In principle, the only reason to have vaping products in the market must be as an alternative to smoking for adult smokers who failed to quit using evidence-based smoking cessation methods such as counseling, prescription drugs, and pharmaceutical-grade nicotine products, and only after understanding that vaping products are associated with direct harms such as lung illness. Second point, to protect underage youth and non-smoking adults from initiating vaping, the product must be available under very strict legislative parameters. Third point, there is a real risk of youth will transition from vaping to smoking. This gateway hypothesis has been substantiated by published studies. That risk should always be considered of utmost importance when weighed against the inconclusive evidence on the potential of e-cigarettes to be used as a smoking cessation aid. As for the policy levers within Bill 233 and the taxation and the budget announcement, I have 4 points I want to make. The first, capping nicotine concentrations at 20 milligrams per ml is crucial. That's the European Union's limit, and it will help reduce youth addiction to the product. Smoke-Free Nova Scotia survey of 670 youth and young adult vapers revealed that among youth who vape using nicotine-based e-cigarettes, the majority of them, about 66.5% of them, used 50 milligrams per ml or higher concentrations. Just take a few seconds to think about that. Underage youth vapers in Nova Scotia vape concentrations of nicotine that are 2.5 times more than the legal limit in the European limit. Okay, European Union. That's disturbing, and Bill 233 will help rectify that. Second point, taxation is a needed policy lever to reduce the affordability of vaping products to youth because they are more price sensitive. Smoke-Free Nova Scotia's survey that I just referred to found that 63% of underage youth vapers are able to afford the products themselves. This suggests that affordability is not an issue for them prior to the tax increases, and that's why those tax increases are much needed. 3, tightening loopholes for smoke-free places by including patios within the definition of smoke-free areas is important to denormalize both smoking and vaping behavior. There is overwhelming evidence to support smoke-free policies. Because of the limited time, I find no need to delve into the evidence there. Number 4, adding to the enforcement powers of peace officers with respect to vendors and employees of retailers that sell vaping products is important to reduce illegal sales of vaping products. And I stress here, enforcement at the vendor and retail employee level. Smoke-Free survey found that 33% of youth who vape report retail locations as the most frequent access point, okay? By comparison, only about 10% access them online. So the vape shops are selling them to underage youth. In closing, Smoke-Free Nova Scotia is not only stressing the importance of Bill 233, but adopting further vaping control measures. Increasing the minimum age to 21 is one of these. And in closing, Nova Scotian youth protection is warranted, and I urge you to adopt Bill 233.
Thank you, Mr. Hamdani. Mr. Johns.
Thank you, Mr. Chair. Mr. Adani, thank you very much for coming today. As a representative of Smoke-Free Nova Scotia, I would assume that you're more, especially as executive director, I would assume that you're more of an authority than some of the speakers who've come are just speaking off the cuff and how vaping makes them feel. I have a couple quick questions. How many chemicals are in traditional combustible tobacco products, and how many chemicals are in vaping products is one of the questions I'd ask first. And then the second question is in regards to the types of products that are around. Are you familiar with the different types of products?
Mr. Hamdani.
It's Dr. Al-Hamdani. Not that that's important, but to differentiate the credibility when it comes from the sources, and to I don't feel the need to describe my credentials. I do have a PhD. I have postdoctoral training for 2 years in an addiction lab, and my specialty is consumer addiction. So I speak, yes, from a point of authority. To answer your question, 41 cytotoxins on average in vaping, about 4,000 to 7,000 chemicals in tobacco. That's, I believe, that was your first question. In regards to your second question, there are a different range of products. Some of them resemble cigarettes, don't contain nicotine, do not have refillable nicotines or e-liquids. Others look like the tanks or mod products, where you can basically open the vials, add the e-juice. Sometimes it can contain nicotine, sometimes it doesn't. But really the discussion should be focused on pods, because that's what is being sold and has the largest market share, especially in regards to youth. And those are closed systems, replaceable cartridges, contain additives that increase the effect of nicotine on the brain by making it a lot more addictive. Some of the chemicals that are added to it to ensure that that goal is achieved is benzoic acid.
Ms. LeBlanc.
Thanks, Mr. Chair. I have 2 questions, so if you can put me on the list again, that would be great. Thank you for your presentation. My first question is, there's scientific data to suggest that there is lung cancer rates associated with vaping, and that's to do with the atomization of the inhaling, like the microparticles, and that could be impacting lung health. So the particles get stuck in the lungs, and therefore it can, so the way you're looking at me suggests that maybe you've not heard about this. Can you talk about it?
Dr. Al-Hamdani.
My understanding is that the link, if any, there isn't a conclusive link between vaping and lung cancer, but there is an association between vaping and lung illness, formerly identified as EVALI or e-cigarettes, and vaping illness injury, I believe, the acronym, that's what it refers to. There's about 2,000 cases, over 2,000 cases in the US. 54% of those, by the way, used nicotine. So what you heard earlier is inaccurate. 14% of those over 2,000 cases used nicotine only. And when in that same survey that informed the CDC's report, out of those nicotine users, there was I believe there was about 69% that said that they got it from formal commercial sources. So it's not an issue of illicit vaping use.
Ms. McCrossan.
Thank you, Mr. Chair. I'm wondering if there's any research that supports harmful health effects of vaping liquid without nicotine.
Dr. Al-Hamdani.
Because e-juice or vaping products with no nicotine don't hold a significant portion of the market share. When we conducted the survey, I believe about less than 5% said that they used e-juice with no nicotine. I believe that the reason we don't have a lot of evidence on these kinds of products simply has to do with the fact that they are not likely to have a significant public health impact. So I believe that the focus should be on nicotine-based e-cigarettes.
Mr. Johns.
Thank you very much. I'd love to sit down and talk with you sometime because I think you'd probably know just about everything I want to know. So I'm curious in regards to secondhand smoke. Whether or not vaping products have the same concentration of secondhand chemicals that traditional combustibles would have, and also if you were actually, I think you're very knowledgeable. Were you or Smoke Free Nova Scotia consulted in this legislation before it came forward?
Dr. Al-Hamdani.
So I'm going to get you to repeat your questions because everybody seemed to ask me 2 questions in a row. My memory span is limited. So maybe the first portion only, if you remember.
So if I may, we're over the time.
Okay.
I'm trying to be flexible here, but I would ask that committee members keep their questions to the point and restrict themselves to 1 question at a time. Mr. Johns.
Yeah, thank you very much, Mr. Chair. And so my first question was, could you please tell me in regards to secondhand smoke, if vaping smoke has the same number of toxins that secondhand smoke would have from normal combustibles?
Dr. Al-Hamdani.
Logically, it wouldn't, just simply because by content they contain a significantly less amount of chemicals. The only research that I'm aware of in terms of secondhand vapor that is being absorbed into the bodies of non-vapors has shown detectable levels of nicotine. Once again, this research is in its infancy, as have been alluded by my colleague from cancer. And if we look at the 1950s, when the evidence for tobacco harm started emerging, at that point, it was really too late to try to reduce the impact of the issue, because for the following 5 decades, we continued to have higher lung cancer rates than we did in the 1930s. And I believe that in the 1930s, we still had lower lung cancer incidences than we do in 2010, until at least in the US, as identified in the Surgeon General's report on tobacco.
Ms. LeBlanc. Final question.
Thank you, Mr. Chair. Earlier, I asked Dr. Ernest about about, the different smoking cessation drugs, and he said that the difference was that those drugs, like the patch or Nicorettes or whatever, there's an end in sight, and they're only used, I'm assuming people get weaned off them. In your work, do you see a scenario in which a low-dose vaping product could be added to that regime where, like, if it's treated in the same way, under the supervision of Smoke Free Nova Scotia, where there's a counseling and attached in the same way that it's used for those programs that Smoke Free Nova Scotia uses?
Dr. Al-Hamdani.
If the manufacturers of vaping products truly believe that their products are safe, then why don't they go through the same regulatory processes that are extremely rigorous when it comes to nicotine replacement therapies that are formally approved by them when it comes to the pharmaceutical grade products? I think you can guess what the answer would be to that. And so if they believe that it's safe, let them go to those processes. As far as the question that you asked earlier, I can actually give you a very exact number. There's a study that many pro-vaping groups actually keep citing, and that same study includes that very concerning information on how many e-cigarette users continue to use it, continue to use e-cigarettes after using it to quit smoking. So after 1 year of using e-cigarettes as a smoking cessation aid, 80% of them continue to use it. That's not the goal of cessation. That's sustaining addiction, not getting rid of it.
Thank you, Dr. Al-Hamdani. Appreciate your comments. Kim Pai. Please come forward. Kim Pai. In the absence of Ms. Pai, we'll continue. Should Ms. Pai arrive, we will do our best to fit her in. Mike Methrow, President of Divine Laboratories. Just a reminder, a total of 10 minutes. Be seated, sir. Thank you. 5 minutes to present, 5 minutes for questions. I will give you a warning at 4 minutes so you know that 5-minute mark is approaching. And should you continue beyond the 5-minute mark, recognize that diminishes the opportunity for questions. Mr. Meth, is it Methrow? Methrow. Very good. The floor is yours.
Thank you. Again, my name is Mike Methrow. I am the president of Divine Laboratories and the chairman of the Vaping Industry Trade Association, or VITA. Divine Laboratories is one of Canada's largest e-liquid contract packaging facilities, where we manufacture for many Canadian brands and produce over 150,000 unique SKUs. Of those SKUs, approximately 10 to 15,000 are some form of tobacco flavor. This will become more relevant later in my message. I'd like to start by recognizing the Nova Scotia government's well-founded efforts in addressing youth vaping in this province. It is clear that this is a problem that must be addressed, but it must be addressed sensibly without creating further unintended harm. The blanket prohibition on flavored e-cigarettes set to come into force on April 1st, 2020 will create several harmful consequences, including depriving adult smokers of a well-recognized harm reduction mechanism, driving individuals back to combustible tobacco, and facilitating a black market. Nova Scotians that have quit smoking or are transitioning from smoking with the use of vaping products are being ignored through this approach. We have thousands of customers that rely on flavor for their vaping products to keep them away from combustible tobacco. Flavored e-liquid is recognized as a key element in successfully transitioning from smoking. Flavored products available in adult-only specialty vape shops and other channels, such as convenience stores, offer smokers looking to transition away from cigarettes or quit with a significantly less harmful option. A recent publication in the Journal of Science raises concerns that vaping bans could take away important smoking cessation tool. The publication also points to studies that demonstrate that vaping is a valuable tool for smokers trying to quit. In contrast, there is no evidence available to support that a blanket prohibition on flavored e-cigarettes is necessary to combat youth uptake. With respect to the amendments before the committee today, the term characterizing flavor is complicated by variable sensitivity among the population in detecting flavor chemicals and the variability in odor potency. Further, the legislation is amended purports to allow the sale of tobacco-flavored e-cigarettes. It is scientifically impossible to replicate combustible tobacco scent or flavor before, during, or after use with e-liquids. There is no industry standard for tobacco-flavored e-liquid. As noted, approximately 10 to 15,000 of Divine SKUs are some sort of tobacco flavor. Tobacco-flavored e-liquids are essentially placebo flavorings created from food flavors. Tobacco-flavored e-liquid may be derived from food additives such as caramels, florals, nuts, maples, sweeteners, custards, vanillas, butterscotches, fruits, and many more. Please note, these flavors have never can taste or smell like combustible tobacco. We are comparing two separate nicotine delivery systems. One is combustion, the other is aerosol or steam, to put this in more relative terms. We urge the Nova Scotia government to follow the example of their provincial counterparts in British Columbia, Ontario, and Alberta by ensuring that new regulations and standards are based on the best available evidence as well as robust consultation with a diversity of stakeholders. This is an opportunity for the government to pause and develop targeted policy and regulatory process that address the spike in youth uptake. We need to ensure that we avoid another public health crisis by driving a whole new cohort of smokers and reform smokers back to combustible tobacco or the dangerous and unregulated black market. The amendments place a risk to the rights of liberties of Nova Scotians with respect to their freedoms to choose safer alternatives to smoking combustible tobacco. There are paths forward that safeguard our youth, while also protecting those who legitimately rely on flavored e-cigarettes as tobacco cessation tool. These amendments fail to achieve these twin objectives. We urge the government's reconsideration of its blanket prohibition on flavored e-cigarettes. I'd like to thank you for your time today and look forward to working with you on future regulations, and I'd be happy to answer any questions.
Thank you, Mr. Motherwell. Mr. Johns.
Thank you very much. The previous speaker had made a suggestion that if vaping products and manufacturers weren't willing to go through the same regulatory hoops that other smoking cessation, similar to patches, gums, lozenges, things like that have gone through. Can you tell me why you're an e-juice manufacturer. Why have you not gone through the same regulatory hoops to be approved?
Great question. Twofold. One is...
excuse me, Mr. Motherwell, through the chair, please. I know it's a formality, but...
Pardon me?
I say just wait for my direction through the chair, if you would, please. Thank you. Mr. Motherwell.
Thank you. That's a great question. Twofold to that. One is e-cigarettes are still relatively new to the market. In the last 10 years, we only got our regulations in May of 2018, where there is a pathway. We're looking for Health Canada to provide how that pathway would be done to get these legitimized as a smoking cessation tool. I can tell you as a former smoker, I smoked for 35 years. I got to 2 packs a day. I was in a corporate environment. 7 years ago, I found an e-cigarette. I've never smoked a cigarette since. These products work, but we do need a pathway from Health Canada how to get them to a smoking cessation product.
Ms. Smith-McCross.
Thank you, Mr. Chair. Thank you for coming today. I'm wondering if you could share with us what legislation you would like to see us follow that you've seen in British Columbia, Ontario, and Alberta. What have they put into legislation that you'd like us to follow?
Mr. Motherwell.
I got it this time. Puts me in a bit of a hot seat because we represent multiple faucets, mostly vape stores in Canada. As a manufacturer, also as a trade association, we like to look at the bigger picture from that side. The things we do like is the fact that flavors are essential. Now, you can follow the federal guidelines in that perspective. For example, they put categories banned. For example, custard or confectionery. You can't call it a custard. You have to call it something else that has no descriptors whatsoever and no pictures on the label. That bans the category but allows the flavor for an adult smoker to get their hands on the product. That way if a youth sees the product, it doesn't say what it is in the bottle. That's a very appropriate mechanism. Nicotine caps, I'm on the fence on both of those. I fear if we get too low on nicotine caps, that there are smokers like myself that were 2 packs a day or higher. If we don't give them sufficient nicotine, addiction suggests that it's not effective. They'll go back to the mechanism they're used to. So I think we just need to consult, work together with industry stakeholders and other stakeholders to find the right mechanism, use science and facts to get there.
Thank you, Mr. Metherall. No further questions. Oh, I'm sorry, Mr. Johns.
When in doubt, look here. Thank you, Mr. Chair, very much. Can you please tell me how many individual ingredients are contained in e-juice, not including nicotine?
Mr. Metherall.
You're delaying on me. Good question again. So it can vary. A recipe could be, we use natural or artificial flavors. So we typically would have anywhere from 1,500 to 1,800 different raw material or flavors on hand. So that could be apple, could be grape, strawberry. A recipe is unique to a brand, so they can use anywhere from one particular flavor. Some have 29 different flavors. Those would have chemicals, each flavor would have chemicals in them to create the flavor, if that makes sense. Is that kind of in line with the question?
Mr. Johns.
I guess I was assuming flavor would be one ingredient. So if flavor is one ingredient.
Mr. Metherall.
I could better answer that now. There is propylene glycol, vegetable glycerin, artificial food flavors. Some may use water from time to time. It helps to wick the products. That's it.
Thank you, Mr. Metherall.
Thank you.
Yes, there's still time if there are further questions. Mr. Johns.
Thank you. So what is the highest concentration of nic that you manufacture?
Mr. Metherall.
We manufacture anything from 0 milligram all the way up to, I believe, 55 is the highest we'll go. 66 milligrams is the federal maximum allowable limit. That was also based, it hasn't been brought up today, so I'll bring this up as a reference point. 66 milligrams was based on the lethal dose of a mouse for LD50 when they set the limits for the safety and toxicity of the product. That way, I don't recommend a child get their hand on 66 milligrams and consume it, but that's how the federal government designed this. LD50 is normally done by the size of a rat. Health Canada did a very extensive job of making sure the toxicity was as low as possible to lowest harm. So, but we do manufacture anywhere from 0 to 55 milligrams. We call it high and low concentrations when we do our matrix in the company, so we do about 40% above 20 milligram, and we do the balance under 20 milligram, and we manufacture approximately 250,000 bottles a month. We don't do any closed pod systems.
Thank you, Mr. Metherall. Time has expired. Mr. Charles Biram, FOV Labs. Welcome, Mr. Biram. Is that the correct pronunciation? Byram, thank you.
I got some documents for you guys.
Certainly, the page will have those distributed. Just a reminder, we have 10 minutes in total, 5 minutes for presentation, 5 minutes for question and answer. You can use some or all of that 5 minutes. If you choose to go over, you're imposing on the opportunity for committee members to pose questions. The floor is yours.
Good afternoon. I first want to start off by saying thank you for accepting my request to speak on behalf of my company, FOV Labs, Inc., and the thousands of customers who rely on us every day to supply them with high-quality ISO 7 lab-made and tested e-liquid. I founded FOV Labs in 2016. Sorry, I'm a bit nervous. After being a 10-year smoker, I grew up my entire life watching my mother struggle with addiction to combustible tobacco. That addiction took a major toll on her health at the ripe young age at 42 years old, when she had the first of her many strokes. My mother is now 59 years old, and just last month I had to convince her to move into an assisted living home. She's been through 2 heart attacks, 1 quadruple bypass, open heart surgery, and 7 strokes. She's now legally blind in her left eye and can no longer walk by herself without a walker due to the paralysis from her most recent stroke. Even after watching her struggles, I too became addicted to combustible tobacco and scaled my addiction to 2 packs of cigarettes a day. I knew it was a bad habit, but I did so anyway. My 20s were spent with a cigarette hanging from my lips. When I tried to quit, I chose nicotine patches, which gave me severe mood swings and champics, to which the side effects were worse than smoking. Suicidal thoughts and severe stomach pains were nearly unbearable, so I chose the lesser of the 2 evils and continued to smoke. On my 30th birthday, I decided to give this vaping thing a try. I started with what most people start off with, an AIO pen-style vape and 24 milligram of blue raspberry mango flavored e-liquid. The first few weeks, I kept a pack with me at all times because I didn't believe that vaping would help. I found myself reaching for my vape after every cigarette to change the taste of dirty ash in my mouth and replace it with the blue raspberry mango that I had grown to love. Finally, after 2 weeks, I asked myself why I was continuing to spend so much money on cigarettes if I preferred the taste of e-liquid. That was my first day completely off cigarettes and where I finally broke the chains of addiction. I had done something that my mother tried doing for 45 years. Within a few months, I felt like a brand new man. My energy levels were up again, and the shortness of breath I had was gone. Don't let this image fool you. I may be a bit overweight and stressed to the max, but I feel a million times better than when I smoked. After a year of vaping, I discovered how to make e-liquid and ran with the idea. My mission was now to help every single adult smoker I could find. I wanted, and still do, to help people quit smoking and experience its liberating effects as much as I did. It's my passion, just like many business owners here and vapors who spoke here today. My business flourished because of its business model and its core values. You see, vaping in its entirety was built by people like myself and my colleagues here today who are better known as the grassroots industry. We poured our hearts and souls into our businesses. We sacrificed everything to help others avoid the fate my mother and many like her have faced. Long hours, doubt, financial burdens, and more stress than a human being should ever have to endure. All in the name of helping others quit combustible tobacco and its death sentence. 48,000 Canadians die each year from combustible tobacco. 1 in 2 of its users will suffer the same fate my mother has, and that's why we are here today. The sad reality is that our industry is in jeopardy right now.
4 minutes.
It's facing some of the most stringent regulations the world has ever seen. To compile a 50-cent per milliliter tax on top of a flavor ban is to completely bury the market. A juice bottle that normally costs $40 will now cost $100, increasing the price by 150%, something that is completely unheard of in any other market in the world. A pack of cigarettes is roughly $20 and lasts you a day. A 30 ml bottle of e-liquid, which will last you the same amount of time, will now cost you $30. With this model, cigarettes now become more attractive and completely undermines the harm reduction value of vaping. The projections of this new tax are $2.3 million in revenue. I stand here today to tell you that if this structure of banning flavors and adding a per milliliter tax is allowed to go through, there will be no tax revenue coming from it because the entire market will be wiped out completely. I ask you, why would a current smoker even consider vaping if the product is more expensive and tastes as bad, if not worse, than cigarettes due to its bitter taste? The flavors are what kept me off cigarettes, much like so many adult vapors right this minute. Of all the vapors present in this room today, less than 5% of them are vaping tobacco flavor, and even less are vaping flavorless. Roughly 4% of our sales come from tobacco and flavorless. The majority of our vapors choose fruity flavors. In fact, the vast majority for us represents 56%. The rest choose creams, custards, and bakery flavors. Taste is subjective, and part of what makes vaping such an effective tool for adults is the ability to find flavor you like and stick with it. That's what makes vaping 3 times more effective than any other NRT on the market. Banning flavors in this province will only help a massive flavored e-liquid black market flourish. And if you've been following the news in the States, you would know that the entire EVALI scare was a product of black market THC cards. I just want to say that again. EVALI was a product of black market THC cards. This was confirmed by the CDC months ago. It seems counterproductive to set these stringent regulations to only create an entire unregulated black market that will work against your efforts. Many moons ago, we saw the United States apply a parental advisory sticker to all explicit CDs to hit the market. That sticker was like a billboard for teenagers saying, "Listen to me." Those artists exploded in popularity. Their music became glorified. The same is true about vaping in its entirety. If we treat vaping as a taboo subject and keep pushing a narrative that it's bad for you, it will only increase its appeal. We should be enforcing the TVPA and being stricter on offenders. Vaping should be marketed like it is in the UK, who push fact-based science on its population and educate their teens about its harm reduction value to smokers. We should be constantly repeating, if you don't smoke, don't vape. If you don't vape, don't start. I agree that youth uptake should be addressed and there needs to be clear regulations on that subject. All I ask is that we are consulted so that we can help you solve the problem. If we had agricultural problems, we would speak to farmers, wouldn't we? Let us help you create balanced regulations that keep our products out of the hands of youth and allow adult smokers to have access to harm reduction product that is 95% safer than combustible tobacco, according to the Royal College of Physicians and Public Health England. Let's keep small business owners operational and squash youth vaping together. To summarize, if this is allowed to go through, many businesses will shut down in Nova Scotia, and it's a crying shame to think of, due to the sheer passion this industry was founded on. Current vapers and current smokers will be left with no other option other than returning or continuing combustible tobacco because of its high price and lack of palatable taste. Nova Scotians will be forced to choose a product that is a death sentence. Lastly, with this structure, a massive flavored e-liquid black market will grow exponentially, creating untested product. I implore you to do the right thing, and please take the time to read the documents that I have provided you. In them, you will find our manufacturing processes, e-liquid test results, a study on flavor variability by Dr. Farsalinos, which I really want to highlight. It's truly important. I really would like you guys to read that. And a study on harm minimization and tobacco control by Dr. Abrams, which speaks to the biomarkers of harm. Thank you for listening. Yep.
Thank you, Mr. Byram. We have time for one question. Ms. Smith-McCrossan.
Okay. Thank you, Mr. Chair. Thank you for coming today, and thank you for sharing your personal story. And also, I want to thank you for sharing the two documents of research. I really appreciate that. I'm wondering if you have any ideas for us how we could reduce youth vaping and the dangers of that in our province. Mr.
Byram.
I honestly think that a strong education platform would work very well. And the fact that we are constantly pushing this narrative that it's bad for you is kind of like the parental advisory sticker. I really like the UK model, the approach to what they're doing. I find it helps to, if you're telling a child that this is for your grandfather to try to quit smoking, he's going to be less susceptible to do it than if you say it's bad for you, don't do that. We see it with our kids on a daily basis. So there's other ways to go around this as well, but I think that's one of an important one that hasn't been talked about today, and I just wanted to mention it.
Thank you, Mr. Byram, for your time today. Kellyanne Forbes, Project Facilitator with Vaping Advocacy and Education Project, Inc. Please come forward. Welcome.
Thank you.
Just a reminder, we have a total of 10 minutes per presenter, 5 minutes for presentation, 5 minutes for question and answer. I'll give you a 4-minute notice, so you can determine if you continue beyond the 5 minutes, but if you do, you're imposing on the time that my colleagues on the committees would have for questions.
Explaining that.
The floor is yours.
Thank you, sir.
Thank you, honorable members of the committee, for allowing me to speak today. I am a registered nurse and founding member of Vaping Advocacy and Education Project, better known as VAEP. We are health professionals who produce free learning materials that are easy to understand and based in the credible evidence. I incorporated this federal not-for-profit 4 years ago, and I have reviewed hundreds of published articles on the scientific evidence in tobacco harm reduction. I have traveled here from Alberta because the intentions to ban flavors and tax e-liquids will unintentionally cause more harm than good. Nova Scotians exceed the national smoking rate of 15% by 3 percentage points. More alarmingly, 1 in 4 males smoke in this province. That is 9% higher than the national smoking prevalence of males in Canada. Smoking causes 85% of lung cancer and 87% of COPD. It is responsible for 36% of lung diseases, 29% of cancers, and 14% of heart diseases. Nicotine does not cause disease. It is the constituents found in the 7,000 chemicals in tobacco smoke that causes diseases. Nicotine is so safe, anyone, including youth, can purchase gum, patches, and inhalers from drugstore shelves. The current and historical data on vaping repeatedly confirms that vaping is a fraction the risk of smoking. For instance, vaping is less than 1% the cancer risk compared to smoking. The number of adult vapers continues to grow, despite millions of dollars from authority and health-related nonprofits have put into fear-based and incomplete narratives that scare smokers away from harm reduction. As per the youth I have interviewed, and further supported by the credible evidence, youth are predominantly using closed pod devices such as Juul. These closed pod devices are preferred by youth because they are small, which makes them easy to conceal. They are inexpensive. They can be obtained in stores that are not age-restricted, and they have a scant amount of vapor, which allows them to use without detection. Most closed pod brands have less than 6 flavors. In surveys where youth were asked for their main reason for trying vaping, and they could only give one answer, only 14% selected flavors, while 52% stated just to give it a try. Youth try adult taboos as this is normal human development, such as 41% have drank alcohol in the last year. Alcohol comes in a variety of flavors, again, being flavor diversity driven by adult demand. So why
4 minutes. 4 minutes.
So why then are we not seeing a call for ban of flavored alcohol to curb underage drinking? Youth drink alcohol for the same reasons, such as social acceptance, experimenting with adult behaviors, or sensation seeking. Vaping is the preferred method of smoking cessation in Canada because it delivers nicotine through inhalation and uniquely mimics the ritualistic smoking behavior. The vaping industry has been 100% consumer-driven and tailor-designed by smokers. Approximately 700,000 adult vapers in Canada have demanded the production of the thousands of flavors, and tobacco flavors comprise just a minute portion. Adults predominantly use the widely diversified refillable tank devices. These devices have lower nicotine concentration e-liquids and produce larger volumes of vapor than closed pod devices. If flavors are banned, vapors will be discouraged from continuing with harm reduction, and smokers will be discouraged from switching to harm reduction because the essential element of satisfaction to taste preferences will be eliminated from what is the most effective nicotine replacement therapy. As to the proposed tax of 50 cents a milliliter of e-liquid, this tax will make harm reduction as expensive as smoking, and smokers will lose yet another incentive to switch. Further, this will shut down the local mom-and-pop vape shops, which supply the smoker with the essential one-to-one service required to guide the smoker to find the right devices and e-liquid. These small businesses have helped thousands of Nova Scotians quit smoking where the health community has failed, and this specialized service may never be reproduced again. All that will be left are the closed pod devices that youth like so much and who are predominantly owned by tobacco companies. Tobacco harm reduction will be handed to the tobacco industry. Smokers face a certain future of smoking-related diseases, years of long suffering, and very difficult deaths. Despite desperate smokers seeking to address their nicotine addiction with a vastly safer delivery system will have to turn to the black market, which will not be bound by the federal safety regulations. In closing, the $322 million in smoking-related tax expenditures this province pays every year will continue and probably rise without harm reduction alternatives. If we transition smokers to harm reduction, that expense disappears. Thank you for your attention.
Thank you, Ms. Forbes. Mr. Johns.
Thank you very much, Ms. Forbes. So, quick question. In regards to address youth vaping and the uptake of youth vapes, what effect would banning all closed pod systems such as Juul, Vype, Stealth, etc. from convenience stores, gas stations, and only limiting those to specialty shops have on youth vaping?
Ms. Forbes.
Oh, sorry. Well, youth get their hands on all sorts of things they're not supposed to and are restricted. For instance, alcohol or mom's Oxycontin. I, as an RN, am a strong proponent for harm reduction for the most preventative cause of disease and mortality in this country. And I know that a smoker goes through an emotional response when they purchase cigarettes, namely shame, guilt. Having those devices at point of sale, I think, is an introduction into harm reduction, and it's an opportunity for impulse buy into harm reduction. I think the way to curb youth usage is that studies have shown they prefer a harm reduction approach, and they prefer to have all the information so that they can make informed decisions. When they are given don't do this message and a fear-based message, they have a what's known as psychological reactance, and this is when they rebel and do it anyways. I think we need to focus on how nicotine addiction occurs, that it is subtle and it accumulates with each puff they have. They are better educated on tobacco harm reduction than older people because they are more proficient with internet research, etc. So I think that we should really emphasize IDing people when they purchase these devices. Yeah.
Thank you, Ms. Forbes. Time has expired. Appreciate you taking the time you have to appear today. Our next presenter. Yes, I was going to ask you, could you provide a copy of your presentation to the page?
Thank you.
Wonderful. Thank you very much.
So much.
Stefan Scarola. Stefan Scarola. Amy Jones. Amy Jones. Dr. Drew Bethune, Senior Medical Director with the Nova Scotia Cancer Care Program. Welcome, Dr. Bethune. Just a reminder for presenters. So we have a total of 10 minutes, 5 minutes for presentation and 5 minutes for questions from my colleagues on the committee. I'll give you a 4-minute notice to let you know you're coming upon your 5-minute notice. If you choose to go over, just reflect upon the opportunity for colleagues to present questions. The floor is yours.
My background is I spent my life as a chest surgeon operating on lung cancer. I was head of thoracic surgery in Halifax. I was head of the Canadian Association of Thoracic Surgeons, and currently I'm Senior Medical Director of the Nova Scotia Cancer Care Program. I have a busy schedule, but I'm here because I feel this is really, really important. Tobacco addiction is our major health problem in Nova Scotia, and vaping is related to that. Vaping is a pathway to tobacco addiction. It's been shown to be. In Nova Scotia, we have the highest or second highest cancer rates in Canada, incidence rates. We have the worst lung cancer survival rate in Canada. We have the first or second highest incidence of lung cancer in Canada. Vaping has been shown to lead to tobacco addiction, and we look at how we compare Nova Scotia to the rest of the country. Our tobacco rates, smoking rates in schools, high schools, are the highest in the country. We have seen an increase in tobacco addiction, not a decrease in Nova Scotia. Tobacco or nicotine is highly addictive, much worse than alcohol. It's in the realm of heroin and cocaine. So I applaud our legislators in Nova Scotia to be doing something that is extremely important for the health of Nova Scotians going forward. A lot of money has been put forward by the tobacco companies to promote nicotine addiction through the use of vaping. Billions of dollars have been put forward. We live in a society where money buys you what you want. This is a chance for the legislators of Nova Scotia to stand up to that and to do something which really helps Nova Scotians. It helps real people who are not being bought by money. I spend my life trying to make our healthcare system better, but I ask you, legislators, to help us to do our job. By putting this legislation through, this will be one step in the right direction to help us in dealing with an entity which causes untold harm. I won't go on, but tobacco addiction contributes to 19 different cancers, not just lung cancer, COPD, heart disease, stroke, all sorts of diseases. So it's a major problem. We need to do more about tobacco addiction in Nova Scotia, but this will at least prevent us from losing ground, which is what's happening right now. We're losing ground. It's getting worse now because of vaping. It's a serious, serious problem. So by limiting the amount of nicotine in the vaping devices, it's 3 times what it is in cigarettes. It's a very cunningly devised device to cause addiction. So this is really important to me. Probably my time's up. I didn't want to go over time, but it's so clear. There's not much else to say. The only benefits to vaping are the tobacco companies, and it'll give them better profits. And if you're concerned about that, then you better strike the legislation down. But otherwise, there's no downside to this. So I'd welcome any questions you might have.
Thank you, Dr. Bethune, and we're just coming on the 4-minute mark, so we do have we have 6 minutes for questions. Mr. Johns.
Thank you, Dr. Bethune, for taking the time to come today. So I agree with you that vaping is bad, and I think that the the direction or how the government is looking at this is they're selling this to the public as a way to stop youth vaping. My concern is that the legislation doesn't go far enough in some cases to stop the youth vaping, and in other cases it's taking away an opportunity from people who may want to use this as a smoking reduction method. So I'm curious to know if you know the difference between the different types of devices that exist now, the Juuls and the Stealths and those closed pod systems on one hand, and if you're familiar with the other types of products that usually people will use when they're trying to quit smoking or reduce the impacts of combustible tobacco. Are you familiar with the two different types of systems?
Dr. Bethune.
Yes. Oh, sorry. Okay. So I have to press the button, or do I have to wait for your invitation? I don't know my legislative manners. I'm sorry about that. A good question regarding the different types of devices. And in the beginning, the vaping was marketed as a way to stop smoking. The evidence is fairly flimsy about that, and the net harm is greatest in allowing unfettered access to this. So I feel that it's of greater importance to the public health that this be strongly restricted by this legislation.
Ms. Schender.
Thank you. I'm used to this system. Thank you for coming today. We've heard from a number of presenters who say that while tobacco and the additives in cigarettes are carcinogenic, harmful, that nicotine on its own is safe. Can you comment on that?
Yes, I think
Dr. Bethune.
Thank you. Yes, I do think nicotine is relatively safe. Yes, it's what's in it. And as a matter of fact, if you look at vaping devices, there's the potential for heavy metals to be in vaping devices, which is not good for the youth. Also, there's evidence that, of course, as we know, vaping causing severe lung disease, and there's some experimental evidence that shows it can cause COPD also. So it's not completely benign. I think nicotine gum and patches are pretty benign, but anything you inhale has many risks.
Mr. Glavine. Minister Glavine, I'm sorry.
Well, thank you very much, Mr. Chair, and thank you, Dr. Bethune, for your passion to work for a healthier Nova Scotia. I'm just wondering, it's a little bit along MLA Chender's comment, but it's presented as a mist, an aerosol, but there would, I think, some even very fine particulate that would enter the lungs, and isn't that in itself another detrimental health factor that could be part of vaping, let alone the heavy metals and what we're seeing so far? Because it is early days for research, but is there just on that substance going into the lungs alone a concern?
Dr. Bethune.
Yes, I think there has not been adequate research done around it, and the research that has been done has shown some concerning effects from what else goes in the lungs. Quite different inhaling things than eating them or putting a patch. The lungs are very sensitive, as I know in my lung work.
Mr. Burrow. Mr. Johns.
Thank you very much. So just to follow up on that, if you could you explain to me about how many chemicals, including heavy metals, are found in traditional combustible tobacco, and how many chemicals are found in vaping products? Do you know that?
Dr. Bethune.
I'm not an expert on vaping, for sure. I know what it does. I know what the effects are. I know something about the epidemiology, which is all bad. As far as the contents, about 4,000 chemicals in tobacco, and thousands are carcinogenic.
As far as vaping, no, I don't know all of the chemicals that are in vaping.
Ms. Smith-McCrossin.
Thank you, Mr. Chair, and thank you, Dr. Bethune, for coming today. You mentioned in your remarks that tobacco use has gone up, that we've seen an increase. Can you explain that comment, and have we seen an increase in cigarette use? And if yes, in what age category? Or are you referring to an increase in tobacco products through e-cigarettes with nicotine? Can you explain that comment?
Dr. Bethune.
Yes, that's a good question. Actually, in preparation for today, I just wanted to see what the figures were in Nova Scotia youth tobacco, and not tobacco, cigarettes. And grade 12, they've gone from 42 to 53% since between 2014 and 2019. 42 up to 53%, quite alarming. Overall, school children have gone from 23 to 28% cigarette use. That's not nicotine cigarettes. And cigarettes are just what terrifies me. Tobacco is so addictive, it's really hard for people to quit. On average, people try 12 times to quit before they quit, and many, a significant percentage of our population are hopelessly addicted for a lifetime. So youth smoking is very, very important, not to get people smoking first. So thank you.
Mr. Constanzo.
Thank you, Mr. Chair, and thank you, Dr. Bethune. It's wonderful that you are here. I just wanted to know in the numbers of youth and how fast it moved for us, and how did we, how can we educate the doctors, and what are we doing in education at the college, at the doctor's college, or what is the community doing to educate so that we don't let it speed up and take over before, as tobacco has done? How are we going to stop by education, and what are the doctors doing in that respect?
Dr. Bethune.
I would submit we're probably not doing enough. Physicians for a Smoke-Free Canada have been aggressive in bringing attention to this among the physician group. But I don't know about primary care, if there's any particular approach with this. Smoke-Free Nova Scotia, Tobacco-Free Nova Scotia has been also promoting this, but I'm not clear about what campaigns they have. It's certainly an extremely important issue. And as I say, youth smoking is very, very important. We spend all sorts of money trying to get adults to quit. It's expensive, doesn't work all that well if you can stop the youth from starting in the first place. And we, sadly, I hate to say this, but in Canada, we're a backwater. We're second rate in our tobacco control. We have a lot of high rates of smoking, high rates of illness related to smoking, and we need to do better. And this is a step in the right direction, and I thank you very much for putting this legislation forward.
Thank you, Dr. Bethune. Appreciate the time you've taken today to appear before the committee. Colin Dyke. Colin Dyke. Yeah.
We've got 3.
We had some presenters on the agenda that did not previously appear, and I want to give them the opportunity, if they have since arrived, to present before the committee. Kim Pye. Kim Pye. Stefan Scarola. Stefan Scarola. Amy Jones. Amy Jones. Colin Dyke. Colin Dyke. Jacob Williams. Jacob Williams. Ben Giro. Ben Giro. We are just a few minutes ahead of schedule, so in fairness to the presenter scheduled for 1:15, I think we can wait until 1:15 to determine if that individual arrives. Yeah. And we have another that was scheduled for 1:45, so we can recess for a few minutes. We'll reconvene in 5 minutes. 1:15.
tonight?
Who's on?
We can have people take their seats. We'll reconvene law amendments. I would like to go through the list of names of those presenters who did not previously appear to give them an opportunity to now appear. Kim Pye, Stefan Scarola, Amy Jones, Colin Dyke, Jacob Williams, Ben Giro. Mr. Giro was not scheduled to appear until 1:45, and we have an additional presenter scheduled for 1:45. Jonathan Borelli. Jonathan, if you wish to come forward, we can extend you the opportunity to speak early. Just a reminder, I know you've been here for some time, 5 minutes to present, 5 minutes for question and answer. I'll give you a 4-minute notice so you'll know you're coming upon the 5 minutes. If you go over the 5 minutes, you're preventing members from the committee from asking questions. So the floor is yours.
Thank you so much. Thank you for having me. I'll be very straightforward. I had a very well-written speech planned out, and I found out last night that I had 10 minutes to speak. And yeah, figured I wouldn't have time to get into everything that I wanted to get into, but I wanted to just briefly speak about the tax and where the idea of a tax on vaping products would come from. So first I'll start with cigarettes. The idea of a tax on cigarettes was based on the fact that we knew it killed millions of people. And in Canada, where we have a healthcare system that's funded by taxpayers, taxes on cigarettes were meant to cover the cost of healthcare associated with disease from smoking. If we move to alcohol, the idea of taxes and regulations around alcohol were based around similar things, which was the concept that we knew that they harmed families, killed hundreds of thousands of people across, I guess, globally, and we knew the impact it had on health overall. So we decided that we would tax that. I guess I should say in many provinces this is different. In Nova Scotia, alcohol is sold directly through the government. In other provinces, I'm originally from Alberta, private entities are allowed to sell it and it's taxed. Marijuana was considered illegal because they thought it caused extensive harm. Marijuana was vilified as, the word is skipping me, but it was vilified as an evil of society that was addicting our children and killing people. We've now, in recent years, found out that that was wrong, and it became widely considered that it being illegal and punishing people with jail time was not constitutional, and that was the basis behind marijuana becoming legal in Canada. In Nova Scotia, we once again decided that we would be the only ones that would be allowed to sell this product after having sent thousands of people to prison for selling it over the history of 40 or 50 years, or whatever you'd like to put the date at. Prescription drugs have killed tens of thousands of people. In headlines every day, we see the opioid crisis across Canada, across the United States, and across Europe. And to my knowledge, in Canada, we don't have a tax on prescription drugs. I might be wrong about that, but feel free to correct me if I am wrong, but I don't believe we have a tax on pharmaceutical companies. In fact, in Canada, our government actually pays these pharmaceutical companies with our tax dollars. Some of our biggest suppliers of these medications in Canada have recently been ordered to pay billions of dollars in fees in the United States for knowingly encouraging the opioid crisis and concealing the harmful effects of opioid prescriptions. But once again, to my knowledge, these products are not taxed in Canada. And then we have vaping, the reason why we're all standing here right now. The government of Nova Scotia is suggesting to take more than half the profits from the vaping industry because of suggested potential harms. We think it causes harm, but at a glance at Health Canada's website, we see something very different from what you guys are hearing today, which is that there are 0 deaths attributed to vaping and only 7 serious injuries. And of these 7 serious injuries, none of these are confirmed cases of vaping-related injuries.
4 minutes.
Sure. There's an estimated 1 million vapors in Canada and an estimated 55 million worldwide. In total, we have 0 confirmed deaths and 0 confirmed cases of injury from vaping, period. So what is a tax on vaping? Now, I realize this might be a taboo thing to say, but this sounds a lot like extortion by the Nova Scotia government, if you ask me. We're suggesting a tax of more than double the price of a product based on suggested harms that we can't even identify. And if we don't comply, we get put out of business. I can't think of any other way to describe it. I tried to think of a nice term to use. And like I said, I know that's taboo, and I'll say this quickly. I don't mean this as an offense to anybody standing on this committee right now. I'm just purely speaking how it feels from a business standpoint sitting here today. Many narratives surrounding the vaping industry argument has been that we are biased and we will say anything to justify an addiction, that we care only about profits and nothing about health. Yet we are failing to admit the obvious bias sitting across from us in these debates, which is the pharmaceutical industry. The smoking cessation industry is an estimated $27.8 billion in North America, of which the pharmaceutical industry has had a monopoly on for decades in Canada. These are the same companies that contribute the vast majority of the funding for the organizations lobbying for many of these regulations. A couple of these organizations are the Nova Scotia Lung Association, the Canadian Cancer Foundation, Smoke Free Nova Scotia. So let's be very clear that while we may have a perceived bias, so do they. I widely used phrases in sales training at my previous job that the fear of loss is always greater than the desire to gain. With this perspective, I would argue that the pharmaceutical industry has a greater bias than any independent vape shop in Canada could possibly have. Once again, a $27.8 billion industry that they have entirely owned, and us small business owners. There's no comparison. This was evident in this hearing today, not even an hour ago, when a speaker stated that the lung injuries we've seen in the news over the last 6 months were attributed to black market THC. I don't know if I'm saying her name right, DiCostanzo, looked over at Dr. El Hamdani, I don't know if I'm saying that right either, but, and he shook his head vehemently no, implying that the statement that the speaker made was not true and that the lung issues we've seen on the news are not attributed to black market THC. I'd like to finish by quoting the CDC's final briefing posted on their media channel February 26th. And this is word for word quote. Due to the continued declines in new avail cases and the identification of vitamin E acetate as a primary cause of avail, today is the final update on the number of hospitalizations due to avail cases and deaths nationally. The CDC recommends that people do not use THC-containing vaping products, particularly from informal sources like friends, family, in-person, or online dealers. Vitamin E should not be added to any vaping product. So let me repeat one part of that really quick. The CDC recommends that people do not use THC-containing vaping products. Vitamin E should not be added to any vaping product. I'm not sure if everybody here realizes what vitamin E is or if you've seen it, but it's a thickening agent used in cosmetics. It's an oil. All e-liquids are water soluble. I don't know, I feel like people must remember this from kindergarten science class where you put water in a petri dish and put a drop of oil in it and watch what happens. The oil does not mix with the water. The implication that vitamin E could somehow enter a water-soluble e-liquid is preposterous. But yet Dr. Al-Hamdani shakes his head vehemently no when a speaker suggests that THC-containing products were responsible for the lung injuries. So if you believe that we truly have a bias, all I ask you today is to look across the table at who is lobbying against us, and please check their bias. That's all.
Thank you, Mr. Borelli. We have time for one question. Mr. Parks. Mr. Johns, I'm sorry.
Thank you, Mr. Chair. So I missed if you had said this or not in regards to if you previously were a smoker before you started vaping. If so, could you describe the difference between how you felt health-wise, breathing-wise, and just overall between the two, doing the two things?
Mr. Borelli.
So I smoked since I was 13. I quit when I was 24. I quit because my wife, her mother-in-law was diagnosed with lung cancer. My wife was pregnant with our first child at the time, and her mother-in-law her stepmom, never made it to the birth of our first child. And that was my decision to quit smoking. I tried several different things. I tried the patch, I tried Quick Mist, I tried gums. None of them worked for me. Vaping products worked for me. I would say after probably 6 months, I noticed drastic differences. I used to, you can't tell now, but I used to be a competitive athlete. And I mean, once I stopped working out, I noticed that my lung function was horrible. Like if I went to try and play hockey after one shift, I could barely make it off the ice. And then when I started vaping, even without working out, I would go play hockey and I could get through a shift of hockey without feeling like I was gonna fall over, right? So the effects for me were obvious, and I feel like that's, I don't wanna ramble on, but I feel like that's the point that's being ignored here, is that there is 1 million, an estimated 1 million adult vapors in Canada that feel the difference of vaping. And you'll hear all these people talk about these harms, but the reason why vaping got so popular among adults was because of the success stories of people who felt significantly better having vaped. So I hope that answers it.
Thank you, Mr. Borelli. No other questions. We're beyond time on this speaker. I would thank you very much, Mr. Borelli, for your time. I would like to extend the opportunity again to those who were scheduled to appear before we bring the Law Amendments Committee meeting to a conclusion. Kim Pye, Stefan Scarola, Amy Jones, Colin Dyke, Jacob Williams, Ben Giro. Mr. Giro was scheduled to appear at 1:45. It's presently 1:40. I think in fairness to Mr. Giro, we will adjourn for 5 minutes and hopefully see him arrive in that period of time. We'll adjourn until 1:45. Or recess, I guess, is the best. Yeah, we'll recess till 1:45. We'll reconvene law amendments. I will call the next presenter, Ben Giro. Ben Giro. Safe to say that the presenters who are scheduled have not appeared. Mr. Johns.
Yes, thank you very much, Mr. Chair. And based on the presentations that we heard here today, I know that the PC caucus has a couple of amendments that they would like to bring forward, namely one being to look at basing any taxes or charges based on the content of nicotine in devices versus the volume of liquid that a device has. I think it made very clear by presenters here today that that would go further in reducing the availability and the uptake by youth in using these devices, particularly since it seems that the higher nicotine volume ones seem to be cheaper. So we have that amendment that we would like to bring forward, as well as another one. So I'm thinking we may be, and I'll turn it to my colleague for a second for that, if I could.
I think it's important to deal with them one at a time. Do you have an amendment to circulate?
I'm sorry, we do not, and so I was going to ask if it would be okay to actually recess so that we can have those drafted. We have two amendments that we would like to do, and I'm quite sure that probably the NDP caucus may have some amendments as well, but I won't speak for them. So I'd move to recess.
Minister Glavine, I'm sorry.
I move that we move the bill back to the House without amendments and in. Oh, we got to do the motion first. Yeah.
There's a motion first, so if we can hold that, and I think other speakers. Ms. McCrossan, did you indicate your intent to speak earlier, and I may have missed it?
I did have a second amendment that I wanted to propose. I don't know if you want me to wait until this one has been.
Yeah, we'll deal first and foremost with Mr. Johns. Ms. Chender.
I think we heard a lot today. I think the nature of this bill and of this type of regulation is fairly detailed. And so while we would be very interested in seeing the amendments brought forward by the PC caucus, realistically speaking, I don't think we'd be in a position to vote on them until committee of the whole House. And so for that reason, I would support us moving this bill back into the House, and hopefully the PC colleagues, if they were able to get those amendments drafted, could share them with all of us so that we'd have a chance to consider them before such time as we could vote on them properly in the chamber.
Thank you, Ms. Chender. Mr. Johns, you have a motion on the floor.
Yes, just to speak on that motion a second time, Mr. Chair. I guess I would considering what this bill is directed at, which is to curb youth vaping and has come forward, a large part of this bill is to address the concerns of the epidemic of youth vaping right now. I think that it's utmost importance that the committee as well as the legislature take all opportunities to ensure that we have the best legislation possible that comes out to meet that goal, and so I would urge people to please support this motion. Thank you.
We have a motion on the floor to adjourn law amendments to give the PC committee members a chance to draft and present their amendment to the committee. All in favor? Mr. Johns.
In favor. Aye.
I'm sorry.
That's okay, Mr. Chair.
Contrary minded? The motion is defeated. Minister Glavine, if I may, Ms. McCrossan.
Thank you, Mr. Chair. I'd like to also make a recommendation for another amendment to the legislation, and that is to cap nicotine content to 20 milligrams per milliliter. Certainly, we heard overwhelming evidence here today that one of the major concerns is health concerns is with regards to the high nicotine levels found in some of the vaping products. And I'm asking Law Amendments Committee to recess for us to have time. This is a different amendment, though. I'm asking Law Amendments Committee to recess to give us time to prepare this amendment in writing today.
You framed this as a recommendation. I drew the conclusion that you were presenting it as an amendment. Okay. Ms. Chender.
Can I just clarify if what's on the floor here is an amendment or a motion to adjourn and prepare an amendment?
Yeah, there was a motion from Ms. Smith-McCrossin to recess to give the PC caucus time to draft an amendment and present it to the committee. Ms. Chender.
Well, I would just repeat what we said before, which is that we're certainly interested in seeing any and all amendments come forward. I think we've heard a lot of feedback this morning, but again, due to the technical nature of the bill and of this type of regulation, we would prefer to have time to consider the specific wording of those amendments, and we will have time to do that in the Committee of the Whole House.
Thank you. There is another motion on the floor from Ms. Smith-McCrossin to adjourn. She was specific to content. The motion is to adjourn law amendments in order for the PC caucus to draft an amendment and bring it back to law amendments. Those in favor signify by... Mr. Johns, sorry.
Thank you, Mr. Chair.
Red Parks is a good friend.
Okay, nope, that's okay. I do, of course, support this. Once again, I want to reiterate that I think this is a significant piece of legislation, particularly when it comes to protecting the youth in our society in Nova Scotia. And, you know, every opportunity should be given to ensure that this is done properly so that it's the most effective piece of legislation to come forward that curbs and addresses the epidemic of youth vaping in our society. So I do support this motion to adjourn now to come back. Thank you.
There is a motion on the floor to adjourn to allow the PC caucus time to draft an amendment and bring it back to law amendments. All those in favor signify by saying aye. Contrary-minded signify by saying nay. The motion is defeated. Minister Glavine.
Thank you, Mr. Chair. I move that the bill go back to Committee of the Whole House without amendments and use that opportunity to bring forth amendments so that they can be discerned in a stronger manner when they are presented in writing. If there's any technical information that we need to have a consideration of.
There's a motion on the floor to take Bill 233 back to Committee of the Whole. To the House. To continue the legislative process. All those in favor signify by saying aye. Aye. Contrary-minded, nay. The motion is carried. Thank you, ladies and gentlemen, for your participation today.